Hello and welcome. So this is basically our project number 2, and we'll actually be using Power BI. So this is actually on maternal and child health analytics, so that you can actually check on the different issues about the pregnancies, the deliveries, about the infants and the mothers. Then we actually do analyze the complications in pregnancies and the outcomes, everything there when it comes to maternal and child health analytics. So first of all, we have to get our data. It's actually inside a CSV format. So I'll actually get into the home tab there, get data. Then in this point, I click on text stock CSV. Just like that, and you actually wait for it to actually load, and you just have to pick this one here. I'll actually start with the first one there. I hit on open like that. After hitting on open, let's actually try and wait as it loads. And on this part, I would actually want to change the name of my query. It was actually mothers bracket 2. So in this point, you'll actually check that my data is actually dirty. Why? Because you can actually check that for the age I have null like that, and it has to be cleaned. So I'll actually hit on transform data first. That's it. Remove that 2 so that we have it as mothers. Yes, that's okay. And on this part here, this is actually clean, because if I click on this filter button here, you will actually check that there is no blank. So click on it like that so that you can actually check if you have a blank. You can clearly check that we do not have a blank. If we had a blank, it could have been the first one here. But remember, in Excel, when you have actually created a table in Excel, the blank will always be on the last item. But for the Power BI, it will have to be the first item there. So there is no blank, meaning that we do not have a null. Let's also consider the one for the age. Already we can see that we have the nulls, but I would actually click on that filter button so that I can actually tell you where the null actually settles in. It settles as the first one after select all. So what you have to do, because this one is basically a numerical column, so what you have to do in this case here is to replace the null with the median. So we have to calculate the median. So we have to get into the transform tab there. Then inside the transform tab, we have what you call the statistics. I'll actually click on the statistics, then hit on the median. After hitting on the median, we'll actually be having the median to be 32. Now come to these applied steps here, remove that median of 32, then select the whole column again. After selecting the whole column, get yourself into the transform tab. Then we have any column group, replace the values, yes, then hit on replace values. What are you actually replacing? I'm replacing the null with 32. So just like that, I'm replacing the null with 32, and that's actually okay. Allow me to actually hit OK there, and that will actually be done. So null here has been replaced by 32. The same case to this point here, and all the other instances of null in the age column. So remember, this one here is actually the text. That's why you're actually seeing ABC. Remember, this one for the age is actually in decimal format. That's why you are actually seeing 1.2. So we can just convert it into a whole number so that we can have it as whole numbers and not decimal numbers. That's done. So let's actually go into this one here for the race or ethnicity. If I click on this filter button here, you'll actually check that there is no blank. Yes, and you can actually check that the data type is actually ABC, which is actually okay in my case. And scroll again to the right. For the insurance type, click on the filter button there. You can actually check that we have a blank here. So in this point here, I would actually want us to have these instances of blanks replaced with unknown. Yes, for the insurance type, we are actually having the Medicare. We have those ones who are actually uninsured. We have the private insured. We have the Medicare insurance. We have the uninsured. Then we have the private insurance. Then for these blanks here, we will actually say unknown. So we have to select the whole column like that, transform tab there. Then in this point here, for the any column group, I want us to have the instances of blanks replaced with unknown. So just like that. So find what? Find blank. So do not indicate anything there, so that in this point we can have unknown like that. Then just hit on OK. So you will actually check that now we have unknown instead of blanks, which is actually done in my case here. In this point here for the education level, and you can actually check that the data type is actually a text format. In this point here for the education level, the data type is actually text format. That's why you are seeing ABC. So I want us to also check if we have a blank. You can actually check that there is no blank, because we expect all the blanks to be at the top just after select all. Cancel that. In this point here for income group, you can actually check that we have ABC, which is actually a text format. Allow me to actually hit on the filter button there. You can actually check that there is no blank too. And scroll again to the right, and you can actually check that when it comes to the states, we also do not have a blank. Yes. And when it comes to the smoking status, and for the states, it's actually a text format, ABC. For the smoking status, it's also a text format, ABC. And allow me to actually hit on the filter button there. You can actually check that there is no blank. On this part here for the pre-existing conditions, you can actually check that we have blanks. So we have hypertension, we have obesity, we have none, we have diabetes. I want us to replace these blanks here with unknown again when it comes to the pre-existing conditions. So what you have to do is to select the whole column like that, get yourself into the transform data tab there, any column group, replace values, then we are actually replacing the blank which is actually empty like that with unknown. So replace with unknown like that, then I just have to hit on OK. So all the instances of blanks will actually be replaced by unknown. When it actually comes to the parity, I will actually click on the filter button there and you'll actually check that there's no blank. So what parity actually means is that this one here for the parity actually means that when a mother is actually going to the hospital, this one actually means that they already gave birth to one child. So let's say, for example, Jane is actually going to the hospital. So she's actually pregnant. Yes. So she's also going to the hospital to deliver. So this one here for the parity on Jane actually means that Jane already gave birth to one child before. 2 will actually mean that Jane already gave birth to 2 children before this pregnancy. 3 will actually mean that Jane has already given birth to 3 children before this pregnancy. So that's actually the meaning of parity. My data is actually clean, and you can actually check that all the applied steps here for cleaning the data are recorded there. And the name of my query is actually mothers. That's all. So I'll actually get myself into the home tab there. Then I just have to close and apply. So what I have to do is come to this point, close and apply. Then that's all. So it will actually be loaded there. So wait as it actually tries to load. Then you'll actually see it appearing on the other end. It has appeared there, and we can bring the next item, the next table. So what you have to do again is to get ourselves into the home tab there, data group, then get data. Then it's actually inside my text or CSV like that. I'll actually click on it. Then after mothers, we have the next one to be pregnancies. I'll actually click on it, then hit on open. So let's actually wait as it tries to load, and it will actually ask us to load. That is if the data is actually clean or transform data. That actually means we are taking it into Power Query for cleaning. So in this point here, you can actually check that we have null. Obviously, we have null in this point here. We also have null. We have null. So that actually means that we have to take this table here into Power Query so that you can actually clean. So transform data. So after hitting on transform data, it will actually bring us to Power Query editor inside the Power BI. So let's actually wait as it tries to load. So the first column is basically the pregnancy ID, and you can actually see that it's ABC, meaning that it's actually a text format. If I click on this filter button there, you can actually check that we do not have a blank, which is actually okay. For the mother ID, you can actually check that these ones are actually in a text format, ABC. If I click on the filter button there, you can also check that we do not have a blank, which is actually fine in my case. For this point here, which is actually the pregnancy year, that's actually okay. For the gestation age, gestation is actually in weeks. So we have 27 weeks, 41 weeks, 41 weeks, 24 weeks, that's 7 weeks, that 1 weeks, 25 weeks. And you can also check that we have null. So what you have to do is to replace this null with the median. So the best way of actually cleaning a numerical column is actually replacing the null or the blank with the median, not the average, the median. So we select the whole column like that, get yourself into the transform tab there. Then in this point here, number column group, hit on statistics, then you have the median, hit on the median, and you actually check that the median is equivalent to that 2. Now remove the same step there. Then in this point here for the median, what you have to do is to select the whole column again like that, then get yourself into the transform tab. Then we have what you call replace values. Value to find is actually null, and we are replacing that null with that 2. So I have that 2 there, and it's actually okay. Now check that we have that 2 instead of null. Scroll to the right like that. Now you can actually check that for the prenatal visits, that's actually the count. So this is basically 1, 2, 3 number format. You can actually check that if I click on the filter button there, we do not have a blank, so that's actually clean. That column has no blank or null. In this point here for the trimester first visit, you can actually check that if I click on the filter button there, there's no blank still. And you can actually check that these ones are actually text ABC format. Allow me to also scroll to the right like that. In this part too, for the high risk flag, if I actually hit on this filter button, you can actually check that we do not have a blank. And basically you can check that they are actually in text format ABC. In this point here for the complications, I would actually want us to replace the blanks with unknown. So select the complications column there, transform tab, replace values. Then basically we are replacing the blank with unknown. So just like that, blank with unknown. So remember in this point, if it's actually a blank, we are not writing anything. But if it's actually a null, we have to indicate that it's a null so that we can write here that it's actually being replaced with unknown. So hit OK there, and that's actually done. For the delivery type, this is actually cesarean or the vaginal. And the format is actually ABC text format. If I click on this filter button, you can actually check that we do not have a blank. It's actually clean. In this point here for the blood pressure issues, you can actually check that all these are actually the text no and yes. So that's actually a text format. If I click on the filter button there, you can actually check that we do not have a blank too. And finally for the diabetes during pregnancy, you can check that these ones are actually in text format ABC. And if I hit on the filter button there, we do not have a blank. So my data is actually clean at the moment. Now, the final thing that I would actually want to do is to select all the columns, select the first one, then you basically click on the last one again. After clicking on the last one, what we have to do in this case here is to check for the duplicates and remove them. So get yourself into the home tab there. Then inside the home tab, we have the reduce rows group, then remove rows. Then in this part here, remove the duplicates. Just hit on remove duplicates and you'll actually check there, removed duplicates. So this data is actually clean at the moment, and what you have to do is to load. So close and apply. But before we actually close and apply, I want us to have it as pregnancies like that, and no to actually inside it. So pregnancies. So close and apply like that. Then hit on close and apply. So basically you will check it on this part here. So just after these items here for the mothers, we'll actually be having the ones for the pregnancies. So if I click on it like that, I'll actually have the columns for the pregnancies, just like that. Then you can check that I have from blood pressure issues all the way to trimester first visit. Now I would also want us to bring the third item, which is I think the infants. So let's also go and check on it. Home tab there, then get data. Then in this point here, we are going to text stroke CSV. Then in this case, I want us to bring the third item, which is actually deliveries. I'll actually click on the deliveries there, hit on open. Let's actually wait as it tries to load. Obviously, my data is actually dirty, and I would actually want us to go into the Power Query so that you can actually clean this data. You can check that I have null here, and I also have null here, and I have a blank, and it has to be cleaned. So hit on transform data, just like that. And now you are actually seeing that we are inside the Power Query editor, inside the Power BI. You can actually check the logo there belongs to Power BI. This is in a text format ABC. Click on the filter button there. You can actually check that we do not have a blank, very clean column, that one. In this point here for the pregnancy ID, text format, and you can actually check that it's actually ABC, which is actually okay. If I hit on the filter button in here, you can actually check that we do not have a blank, very clean again. So let's also go to the right like that. Delivery date. For the delivery date, you can actually check that we have a date there. So this one is actually what you call a date. I can actually click on it like that. So basically you can check that it's a date. So because it's actually containing the dates, which is actually okay. So if I click on the filter button there, basically we do not have blank. So let's come to this point here for the hospital name. You can actually check that it's actually in a text format. So ABC. Click on the filter button there, and you can also check that we do not have a blank, so cancel that. That's actually very clean. For the delivery mode, these ones are actually text ABC text format, And remember, if you would want to change the text format, you just have to come to this point here. If it's actually containing the decimal places, hit on the decimal number. If it's actually containing the whole numbers, click on the whole number. Percentages, click on this. Date and time, click on date and time. Date alone, click on date alone. Time alone, click on time alone. Duration, something like that. Text ABC. But in this case, it's actually text ABC like that. If I click on the filter button there, you can check that we do not have a blank. Very clean. In this part here, we have null, and this is actually a numerical column, 1, 2, 3. So what you have to do in this case here is to clean this column here. And in cleaning this column, we have to replace the instances of null with the median. So we first have to obtain the median for this column. So select the whole column like that. Get yourself into the transform tab there. Then in this point here, for the number column group, we have statistics there. Hit on statistics, then hit on the median. After hitting the median, you can check that the median is actually equivalent to 4. So now remove that step there for the median. Then scroll again to where we actually have that column, which is actually the length of stay days. Select the whole column again. Get yourself into the transform tab. Then inside the transform tab, any column group, then hit on replace values there. Pick replace values. Then what are we actually replacing? We are replacing the null with the median. So null with the median. What's actually our median? Our median was actually equivalent to 4. Just like that. Hit OK there. That's all. And let's also scroll to the right like that. So for the maternal outcome, you can actually check that these ones are text ABC format. Then in this point here, click on the filter button, no blank. On this point here, for the postpartum complications, you can actually check that we have none. We have depression, infection, hemorrhage, like that, none. But we have a blank here. So what you have to do is to replace this blank with unknown. So select the whole column like that. After selecting the whole column, come to this point here for the transform data tab. Then inside the transform data tab, any column group, hit on replace values. Then you are basically replacing the blank with unknown. So blank with unknown, just like that. So do not always confuse the blank and the null. So for the blank, we are not writing anything here. For the null, we are actually writing the null here. So hit on OK there, and you'll actually check that we have replaced the values there. So finally, for the readmission within the 30 days, you can actually check that we have it in text format ABC, and I can actually hit on the filter button there. And after hitting on the filter button, you can actually check that we do not have a blank. So my data is actually clean. So what you have to do next is to check if you have the duplicates. So click on the first column like that. Then scroll to the right using the horizontal scroll bar there. Then click on the last column. Then after clicking on the last column, we have what you call home tab there. Hit on the home tab. Then come to this point here for the reduce rows group. Hit on remove the rows. Then remove duplicates. Just like that. And this data is finally done. So what you have to do in this case here is to remove that 2 like that. Then come to this point here for the home tab. Close and apply. After hitting close and apply, hit close and apply again. And that's done. So you will actually check it on this case here. Down here, I think, or up there. It actually depends. So deliveries, I think it's actually up there. Yes. So this is it. So deliveries, you can actually check that we have them here. Finally, we have the infants table. We have to bring it here. So we have to hit the home tab there. Then after hitting the home tab, we have the get data. We'll actually click on it like that. Then in this part here, we have the text stroke CSV. So after hitting it like that, we have what you call the infants. Hit on the infants again, then open. So let's actually wait as it loads. So obviously my data is actually dirty, so I have to clean it. So I have to take it into Power Query. So in taking it into Power Query, it actually means that you have to hit on transform data. You can actually check that we have a null here. So hit on transform data so that we can basically clean our data. You can check that this is Power Query editor inside the Power BI. Check the logo there. It's actually Power BI, not Excel. So Power Query editor inside the Power BI. So for the infant ID, you can basically check that these ones here are actually in a text format ABC. That's actually okay. If I can click on the filter button there, you can actually check that we do not have a blank, very clean column there. Scroll to the right again. In this point here, these ones are actually the text ABC format. You can actually click on the filter button there. You can actually check that we do not have a blank again. On this part too, you can also check that these ones are actually the numbers 1, 2, 3 format, which is actually okay. But you can also check that we have a null here. So what you have to do is to replace this null with a median. So to obtain the median, select the whole column like that, get yourself into the transform tab, then come to this point here, hit on statistics, then hit on the median. And the median is basically equivalent to that 117. Now remove this step here. Have in mind that the median is actually that 117. So select the whole column again like that, hit the transform tab there, then any column group, replace the values, then in this part here, replace values, then we are replacing the null with that 117. So replace the null with that 117, just like that, hit OK there. Very fine. So come to this point here again for the score. So after a child has actually been born, we always have a score which is actually taken to check on the activeness of the child. That is, this one here is actually for the appearance. This P is actually for the pulse rate, that's the heartbeat. This G is actually for the grayness. This A is actually for activity, and this R is actually for respiration. So APGAR score, and I want us to actually check if we have a null here. So APGAR score is actually out of 10 for the children. So the most active one will actually take a score close to 10, and a score very close to 5 actually means that the child has scored average. So what you have to do in this point here, you can check that it's actually 1, 2, 3. Those ones are basically the numbers. Hit on the filter button there. You can actually check that we do not have a blank, very clean column there. Come to this point again for the data types. You can check that ABC because they are basically the text. Hit on this part here so that you can actually check if you have a blank, no blank. Come to this point again for the neonatal complications. Then what you have to do here is to hit on the filter button there. You can actually check that we do not have a blank, and the data type is actually text format ABC. For this point again, you can also check that the text type is actually ABC. On this point here, you can actually check that the data type is actually ABC because it's actually a text format. Then hit on the filter button there. You can actually check that we do not have a blank. So let's scroll to the right like that. The length of NICU stay days. It's actually the numbers. That's why you can actually check 1, 2, 3 because it's actually a number format. If you actually hit on this filter button there, you will actually check that we do not have a blank. That's actually clean. On this part too, you will actually check that we have ABC because these ones are basically the text. So if you hit on this filter button here, you also realize that we do not have a blank. That's also okay. And finally, on this case here, these ones are actually the text ABC there. Then on this part too, if you hit on the filter button, there is no blank. So this data is basically okay. So what you have to do now to make sure that this is very clean, select the first column there, hit shift on the keyboard, then you have to pick on the last column. So you have to select the first one, then you hit shift on the keyboard, then you hit on the last item there for the last column. Then inside the home tab there, we have what you call reduce rows group. Hit on remove rows, then remove the duplicates. And the step there will actually be recorded removed duplicates. So what you have to do in this point is to remove that too, and that's actually done. So come to close and apply, then you have to hit on close and apply. So you will actually check on the table. I think it will be the last one. So let's actually go down there. So you can actually check that it's trying to load the infants table, and it's actually done at the moment up here, and you can check it, the infants table. So that's all about cleaning the data and loading. You can actually check that the process is actually very simple. For the numerical columns, make sure you actually replace with the median and not the average. So in some cases, you might actually be required to filter out the entire rows where you have the blanks. In some cases, you can actually replace the blank with the unknown. It actually depends on how your data is. In this point, I want us to check on data modeling. But before you actually check on data modeling, I want us to check on the table views. So you click on this point here for the table views, and you have your tables there. You have the deliveries, you have the infants, you have the mothers, and you also have the pregnancies. So what you are going to do is to create a relationship between these 4 tables so that you can now call it a data model. Before a relationship is actually created, they are basically the tables. But when the relationship has been created, it now qualifies to be a data model. So for data modeling, you have to hit on this point here, which is actually model view. Hit on it like that, and you'll actually realize that PowerView will create the relationship automatically when it actually realizes that we have common columns between the tables. So let me actually show you. So on this part here, you can actually hover your mouse here inside the relationship, and you can actually check that it's a one-to-many relationship, and you can actually check that the common column there is actually the mother ID. If you also come to this point here, you can check that it's a one-to-one relationship. Hover your mouse there. Pregnancy table and the delivery table, they have actually been connected based on the pregnancy ID, which is actually the common column between the two. And finally, on this case here, we have the deliveries table and the infants table. Hover your mouse there inside the one-to-one relationship, and you can actually check that these two tables have actually been linked based on the delivery ID. So in this point here, we have the mother ID, which actually gave us the relationship. On this point here, we have the pregnancy ID, which actually gave us the relationship. This is actually a one-to-one relationship. And on this other end, we have a one-to-one relationship given to us by the common column there, which is actually the delivery ID. Now, remember, if it was Excel, we actually have to drag and drop to the primary key. Like in this point here, this mother ID here is actually the primary key. This one is not the primary key. So we are always dragging towards the primary key. So you could have actually selected this one like that, then dragged it in this point here. So the relationship could have been created automatically. So we always drag and drop towards the primary key. That's it. So we do from many to one, or in short, we drag towards the primary key. So that's actually in Excel. So we'll actually check that when it comes to Excel. But that's all about data modeling. It's actually very simple. The advantage of Power BI is that it will actually create these relationships automatically when it actually detects that there are some columns which are actually common. Like in our case here, we haven't actually done anything. The model was actually created for us automatically. And that's actually the advantage of using the Power BI. So let's actually check in the next video how we can now use this model so that we can come up with the insights. Because we have already cleaned the data, we have also created a model, or the model has actually been created for us automatically. Now I want us to use this model to come up with insights which will actually help us in making the decisions later on. So let's stay tuned and check the next item. So in this point, we are going to check on the maternal demographics and risk profile. So when it comes to the risk, what you are actually going to check on this point here, like allow me to actually hit on the table view there. You can actually check that when it comes to the risk, we have the high risk flag. So it will actually be flagging if it's actually high risk or no high risk. So we have no and yes. You can actually check that we have yes on this part here. If I also scroll down there, you can also check that we have a lot of no's, yes, but we also have some yes. So what you have to do here is to count the number of yes that we have in this column. But because my table is actually too big, what you have to do here is to use the DAX functions. So we have to use the DAX functions so that it can actually do that for us automatically. So this is basically the point where we have the high risk flag, and the table is actually the pregnancies table. So get yourself into the pregnancies table there, hit on the three dots and hit on new measure, or you can just come to the table there, then right click on it. After right clicking, we have then the same thing, which is actually the new measure. So hit on it like that. Then in this point here, we will actually say the high risk count, because you are actually counting the number of yes. So high risk count, just like that, because you are basically counting the number of yes. So space equal sign a space. So what you are actually going to do in this point is to count the number of yes, but that column is basically inside the pregnancies table. So what you are doing is to use calculate. Yes, so calculate the number of rows. So we have to use count rows. Yes, so we have to use count rows, then we actually open. So we are counting the number of rows inside the pregnancies table, just like that. So we are counting the number of rows inside the pregnancies table. Yes, and in that table, the column has to be equivalent to high risk flag. So this high risk flag is actually inside the pregnancies table. So preg like that, then you actually pick the high risk flag, just like that. So calculate the number of rows inside the pregnancies table. Yes, and in that pregnancies table, the column has to be high risk flag column. Yes, and in the high risk flag column, what you are basically counting is the number of rows having the output yes. So it will now be counting all the yes inside the high risk flag column, and this high risk flag column is basically inside the pregnancies table, just like that. So what you have to do is to hit enter on the keyboard, and we will actually have a measure there called the high risk count. So make sure you actually understand these DAX very well. So we are counting the number of rows in this pregnancies table where the column high risk flag contains yes. So to actually use that where, you have to use calculate. So that calculate actually brings the aspect of where. So obtain the number of rows in the pregnancies table where we actually have yes as the output inside this high risk flag column, just like that, and we have our measure there. So to actually check on the output, we can hit on a card there. Then we just have to drag the high risk count into the card, and you can basically check that we have a total number of 315 counts of yes. But what does this 315 actually represent as a percentage? So we also have to obtain the high risk percentage. So to obtain the high risk percentage, it's actually very simple. So what you have to do is to come to this point again for the pregnancies table, right click on it again, then hit on new measure. So what you have to call this is actually the high risk, not count this time round, but percentage. So the high risk percentage, space, equivalent sign, a space. So what you are going to do in this case here is to divide. So divide. So we are dividing the high risk count by the total number of counts. So high risk count, in short, high risk count by the total number of rows that we have inside the pregnancies table. So what you actually have to do is to insert a square bracket. If you insert a square bracket, it will actually get you these kinds of measures there. So you have to click on high risk count. You just have to insert a square bracket like that. Then you have to hit on it. Then a comma. Then we are dividing the high risk count by the total number of rows that you basically do have inside the pregnancies table. So to obtain the total number of rows that you have inside the pregnancies table, we actually saw that before. We actually use the count rows function. So count rows like that, then you actually open and you have to type PR like that, and you'll basically have pregnancies. So you click on it like that, then you close the count rows function. Then the alternative result or the alternate result, if this one is actually an error, then get me a 0, just like that, and you close the divide function, then you hit enter on the keyboard, and it will actually get us something like 0 point something, because we have not actually converted to percentage. So it will actually get us, let's say, 0.17. So let's actually confirm that. So hit on the card like that. After hitting on the card, drag this high risk percentage into the card like that, and you will actually get 0.29. So what you have to do so that you can convert this 0.29 into percentage is to click on the measure that we actually inserted there, that's high risk in terms of percentage. Then come to this point here for the measure tool stop formatting. Then this down arrow here, you have to hit on percentage. Then after hitting on percentage, you'll actually have 28.64%. Remember, you can always increase the decimal places and decrease them again using this point here. Let me actually show you. Hit on the measure again using this point here. You can take it to 3. So it will be 28.64, 28.636. You can take it to 2, 28.64. So basically, we have actually obtained the high risk in terms of percentage, and we have actually obtained the high risk count again. So because we actually have the high risk percentage, I want us to check on which groups are actually having the high risk when it comes to the pregnancies. So we'll break down this in terms of let me actually scroll up there. We will actually break down this in terms of age. We will also break down this in terms of education, in terms of insurance, in terms of income, which will actually be a socio-economic factor, in terms of parities, in terms of smoking status, in terms of race. So we'll actually break down that so that you can basically understand the whole idea, because the main purpose is not actually just getting the cards. The main purpose is actually getting the insights from this data so that decisions can actually be done. It will be so meaningless to actually have cards like this dropped here and nothing actually happens. We have to come up with the insights from our visualization so that you can actually understand what's actually happening. Because the most important thing is actually understanding what's happening so that you can give a preventive measure in case the risk is actually too high. So in this point, I want us to check on the race which actually has the highest high risk pregnancy rate. So what you have to do is to click on the matrix like that, because you are actually interested with the race. So what you are going to do is to drag, scroll down there to where we have the ethnicity. So it's actually here, drag it into the rows like that. Then scroll down there to where we have the values. Then scroll down to, in this point here, to where we have the high risk in terms of percentage. Drag it into the values there. So that's it. Allow me now to hit on the focus mode. So in this part here, we have the values here. Then in this point here, you can actually hit on the down arrow so that you can actually sort in an ascending format. Then you can also hit on the arrow again so that you can basically sort in a descending order. So you can actually check that the race with the highest high risk pregnancy rate is actually the Asians. And the rate is actually at 32.50%. It's actually very high because the second one is actually 28. So Asians actually have the highest high risk pregnancy rate in the USA, according to our data there. And we can also break down this. Allow me to actually take this to this point here. We can also break it down still based on the delivery types. So what you have to do in this case too is to hit on a matrix. After hitting on a matrix like that, we have to drag the high risk count into the values. But before we actually drag that into the values, I want us to drag the delivery type into the rows. Then we also drag the high risk percentage, that's the high risk percentage, into the values. Just like that, and we'll actually be having something like this. Allow me to actually hit the focus mode. So in this point here, it will actually be showing us the delivery type which actually has the highest high risk pregnancy rate, which is actually the cesarean, and it actually has 29.66% as compared to the vaginal, which actually has 27.56%. I would also want us to come up with some analysis when it comes to education. So allow me to hit on the matrix. Then after hitting on the matrix, what you have to do is to drag the education level. Search for the education level up there. We have the education level here. Bring it into the rows. Then down there, we also do have the high risk percentage. Then you have to drag it into the values. So high risk percentage into the values like that. And allow me to also hit the focus mode there. So in this part here, you can actually check that the highest one is actually 32.12%, which is actually bachelors. So we can actually conclude that mothers with the bachelor's degree have the highest high-risk pregnancy rate, standing at 32.12%, and the mothers with the college education level have the lowest high-risk pregnancy rate, standing at 25.94%. That's it. So you can actually check that it's bachelors with the highest 32.12%, followed by the master's degree 28.62%, followed by the high school 27.61%, and finally the college 25.94%. So the lowest risk is actually on the college mothers, 25.94%, and the highest risk is actually on the mothers with a bachelor's degree, and it actually stands at 2.12%. Let's also have a conclusion when it comes to the income group. Does the income group actually influence the risk? Because we have already checked on the education level. So I want us to actually check on the income group, because education, income, and insurance will actually be part of socio-economic factors. So what you have to do in this point here, we actually hit on a matrix. After hitting on a matrix, allow me to actually expand it like that, bring it to this part here. Then what you have to do is to scroll up there to where we basically have what you call the income group. Then inside the income group, we have to drag it into the rows. After dragging it into the rows, scroll down there to where we do have the high risk percentage. Then inside the high risk percentage, drag it into the values like that. And that's all. Now in this point here, we can actually come up with a conclusion that mothers who are actually inside the medium income group have the highest high risk pregnancy rate at 30.77%, followed by mothers in the low income group who have the high risk of 28.31%. Then we have mothers in the high income group with a high risk of 26.92%. So the highest high risk pregnancy rate is actually from the mothers in the medium income group, standing at 30.77%. And finally, when it comes to the socio-economic factors, I want us to also check on the influence of the insurance type on the high risk percentage. So for the insurance type, hit on the matrix there, then expand it, then you have to drag it to this part here. Then what follows is to drop the insurance type. So drop the insurance type into the rows like that. After dropping it into the rows, scroll down there to where we have the high risk percentage. Then you actually drop it into the values. So high risk percentage into the values like that. Then hit on the focus mode. So in this part here, you can actually check that for the Medicaid, we have that 1.20%. For the Medicare insurance, we have 26.18%. For private insurance, we have 27.56%. For uninsured, we have 29.07%. For unknown, we have 28.41%. So basically, you can actually come up with a conclusion in this point that the mothers who actually use the Medicaid insurance type have the highest high-risk pregnancy rate of that 1.20%. And the mothers who actually use the Medicare insurance type have the lowest high-risk pregnancy rate, standing at 26.18%. It's actually the high risk still, but it's actually the lowest as compared to these other insurance types here. So that's all when it actually comes to the insurance type. And that's all when it also comes to the socio-economic factors. So socio-economic factors, you have seen the insurance type, the income group, and also the education group. For the delivery type, we have also checked on that, and we have also seen on the race or ethnicity. I would also want us to check on the impact of the age when it comes to the high risk pregnancy rate. So for the age, what you have to do in that point is to hit on a matrix. So I'll actually hit on a matrix like that. Then this is it. So I'll actually bring it to this part like that. So what you have to do is to drag the age into the rows. So drag this age into the rows like that. Yes. And you'll actually check that we have 18, 19, 20 like that all the way up to the last age there, which is actually 44. But this is not what I actually wanted. I wanted that to be in terms of bins. That is from 15 to maybe 19, from 20 all the way to maybe 24, from 25 all the way to 30, something like that. So what you have to do again is to hit on this down arrow there, hit on this new group, then it's actually age in terms of bins, which is actually okay. We are basing it on the size of bins, which is actually okay. Group type is actually bins, which is actually okay. Then I'll actually say the bin size is actually equivalent to 5, just like that. And you just have to hit on OK on this part here. So that's actually done. And you can actually check that it's now 5 because it actually runs from 15 all the way to 20, 20 all the way to 25, 25 all the way to 30, 30 all the way to 35, 35 all the way to 40, just like that. So it's actually working. And so this one here actually means that it's 15 to 19. This one here actually means 20 all the way to 24. This one here means 25 to 29. This one here means 30 to 34. This one here means 35 to 39. And this one here means 40 to 44. So don't start asking yourself why you are not actually seeing 44. This one here is actually 40 to 44. So it's actually a range. So what you have to do in this point is to drop the high risk percentage into the values. So look for the high risk percentage down here. Then you actually drag it into the values like that. And that's actually done. And allow me to actually hit the focus mode there. So in this point here, you can actually check that the age group with the highest high risk pregnancy rate is actually this one here, which is actually 40 to 44. And the rate is actually that 1.25%. It's actually high. And the age group with the lowest high risk pregnancy rate here is actually 15 to 19, with the high risk rate standing at 24.68%. So these ones are actually better, and this group is actually the worst. That's all about breaking down this in terms of the race, the age, the delivery type, education level, income group, insurance type. I want us to also check on the impact of parity when it comes to the high risk percentage. Remember, I actually told you that a parity of 1 actually means that this mother already gave birth once. A parity of 2 actually means that they have given birth twice. A parity of 3 actually means that they have given birth 3 times. I want us to actually check if the number of times that these mothers have actually delivered has an impact on the high risk percentage. So let's actually check on that. So what you actually do is to hit on the matrix. So after hitting on the matrix, you'll actually have it on this part here. Allow me to actually expand like that. Allow me to actually expand it like that. So the next item in that case is to drag the parity. So look for the parity, drag the parity into the rows like that. Then you also have to drag the high risk percentage into the values. So scroll on this point down there to where we have the values, high risk percentage into the values. Now hit on the focus mode there so that you can see that clearly. So we can clearly check that mothers with a parity of 4 have the highest high risk pregnancy rate, standing at 33.33%, and mothers with a parity of 3 have the lowest high risk pregnancy rate, standing at 27.45%. So that's also in this point I want us to check on the racial or ethnic disparities analysis. So we'll be comparing the analysis between the whites and the blacks in this point. So I want us to check on the preterm birth rate for the whites, that's for the white mothers, and the preterm birth rates for the black mothers. So remember, we had actually obtained the overall preterm birth rate, and I can actually show you overall preterm birth rate. So we had it here. This is the preterm birth rate. It's actually inside which table? It's actually inside the infants table. So we actually created the overall preterm birth rate, but I want us to actually check the preterm birth rate for the whites, that's for the white mothers, and also check for the black mothers. In this point, I want us to apply filtering so that we will be obtaining the preterm birth rate where the mothers are actually white, or the preterm birth rate for the mothers who are actually black. So it actually means that we have to use the filtering there. So yes, we'll actually be sticking to the preterm birth rate, but we'll be applying the filtering. So allow me to actually show you how we'll apply the filtering. So to apply the filtering, we'll actually say where the mother's race is basically white, or where the mother's race is basically black. So we'll say preterm birth rate for the black. That's for the black mothers, space equal sign a space. So the preterm birth rate for the black mothers is basically equivalent to the rate. Then you actually apply filtering on that rate to be for the race equivalent to the black. So let me actually show you how that is actually done. So we are actually calculating the preterm birth rate, and we already have the preterm birth rate. So use a square bracket there so that you can obtain the preterm birth rate. That's the general preterm birth rate. So I would actually want us to filter out so that we can obtain for the white mothers only. So comma, where the mother's race is actually equivalent to white. So the race is basically inside the mother's table. So let me actually scroll to this point here so that I can actually show you. You can check that the race is actually here, and it's actually inside the mother's table. So where the race, which is basically inside the mother's table, so select the race. So scroll down again so that you can pick on the race. So where the race, which is basically inside the mother's table, is equivalent to white. So we are starting with the white mothers. So you close the quotation like that, then you close the calculate function. So we are obtaining the preterm birth rate. We already have this measure. That's why we actually use a square bracket there. So obtain the preterm birth rate where that use of where is actually brought in by calculate function. So where the mother's race is basically equivalent to white. White is actually under a quotation because it's a text. So sorry, in this point, I want us to actually have it as white. Yes. So the moment I hit enter there, we'll actually be having a new measure, which is basically inside this infants table here. So inside the infants table, we have the preterm birth rate for the white mothers. So let's also obtain for the black mothers. So for the black mothers, we'll actually change that white to black and also change this white here to black. We can just start writing it from scratch so that you can actually master this. So hit again, then hit on a new measure. It will be the preterm birth rate black. So preterm birth rate, like that, space, then black, then a space equal sign a space. So we are using the calculate. Yes, the preterm birth rate. So preterm birth rate, click on it like that. So the general preterm birth rate. So calculate the preterm birth rate where the mother's race is basically equivalent to black. So the race is basically inside the mother's table. So scroll down there to where we have the race stroke ethnicity. So race stroke ethnicity. This must be equivalent to black. So opening quotation, black, and closing quotation like that. Then you close the calculate function. The moment you hit enter there on the keyboard, you will have a new measure there inside the infants table. So we have two measures here. So let me also scroll down like that so that you can check. We have the first one being the preterm birth rate for the white mothers and the preterm birth rate for the black mothers. I can actually use a card like that, and two cards actually. So I'll click on it again, Ctrl C, Ctrl V to actually copy and paste. So just like that, and I'll drag the first one there, which is the preterm birth rate for the black mothers, to the first card there. Preterm birth rate for the white mothers to the second card there. So that's it. You can check that it's 0.57, which is 57%. So it's actually for the black mothers. Come to this point again, click on that measure there, measure tools tab, then formatting group here, then hit on this point here, convert to percentage, just like that. It's actually 57.40%. So let's also go to the white mothers there. So we have to click on it once there, then measure tools tab, formatting group, then hit on the down arrow there, then we have to select percentage. So it's basically equivalent to 61.57%. So in this case here, because we have for the black and the white, we can as well obtain what you call the disparity ratio, black to the white. So to obtain the disparity ratio, that one will actually be very simple. We have to use the divide function. So scroll up there, infants table here, right click on it, then hit on a new measure there, then just write disparity ratio. So I'll hit on a backspace like that, then disparity like that, space, ratio, space, equivalent sign, a space. So in this point, it will be black divided by the white. So this is actually a measure. Preterm birth rate black, it's actually a measure. Preterm birth rate white, it's also a measure. So what you have to do is bring the square bracket there, preterm birth rate. So you can just type pre, so that you can have preterm birth rate black divided by, that's a comma, divided by the preterm birth rate white. Again, then alternate result is basically a 0. Just like that, I close the divide function. We are supposed to introduce a divide function there. Sorry. So divide. So divide preterm birth rate for the black mothers by the preterm birth rate for the white mothers. So the alternate result is basically a 0. So the moment I hit enter there, we'll be having a disparity ratio as a measure inside the infants table. So we can click on it like that. Then we can just drag the disparity ratio into the card, and that one will be 0.93. So this is basically very close to 1. So that's all about the racial analysis, and there's a lot you can actually do here, but this is the major thing that you can actually do here. So you can obtain the different preterm birth rates for the different races, because you basically have for the world races. I can actually hit on a matrix there. So you drag in the race or ethnicity into the rows like that. Then down there, we also have values field. So you have to drag in the preterm birth rate into the values field like that. And basically you can check that for the black mothers, we have 57.40%. For the white mothers, you can basically check that we have 61.57%. And the disparity ratio, that is black divided by the white, will actually get to 0.93%. So in this case, I want us to check on the postpartum and readmission analysis. So you'll actually check that when it comes to the infants there, we basically have what you call postpartum complications. So we have postpartum complications, and we basically also have readmission within 30 days. I want us to check on the postpartum readmission rate. So for us to check on the postpartum readmission rate, allow me first to actually show you that table. So it's basically for the deliveries. You click on the deliveries there. So you can actually check that in this point here, scroll to the right, and you'll actually check that we have postpartum complications. We have none, depression, none, hemorrhage, none, depression, infection. A lot of them are non-infections. And readmission within 30 days. So for the mother who actually had no postpartum complications, they are not readmitted. This one here, not readmitted. This one, not readmitted. And scroll down there so that you can check the mothers who are basically readmitted. So the ones for yes, you can actually check that you have for yes, hemorrhage, yes, infections. So we can actually see that we also have mothers who are readmitted within 30 days. That is after they have actually delivered. So for those mothers who actually had the complications, they were readmitted. But some of them who also had complications were not readmitted. Like for example, this one here, depression, not readmitted. This is a complication, but not readmitted. So I would actually want us to check on the number of mothers who were actually readmitted so that we can now obtain the postpartum readmission rate. So we first obtain the count. So to obtain the count, we'll actually be focusing on this readmission within 30 days column so that we count the number of years that we have in this point here. And for the rate, we'll actually say the count of years divided by the total count. Now let's actually go into this part here. So we are basically inside the deliveries column there. So we actually right click, then we actually hit on new measure there, and we'll say postpartum readmission count. So remove the measure there and have postpartum readmission count, just like that, space equivalent sign a space. So in this point, we are now going to use the calculate function and the count rows function. So calculate like that, then you also open count rows, then you also open. We are basically dealing with the deliveries table. So deliveries table like that, then click on it, then close the count rows function, comma. So we are counting the number of rows inside the deliveries table, and the column has to be readmission within 30 days column. So to obtain the readmission within 30 days column, we have to type deliveries like that so that we can now obtain readmission within 30 days. It's actually the last one. So readmission within 30 days. So you click on it like that, and now you can actually check that it's okay inside the deliveries table, and the column is readmission within 30 days column. And it should be equivalent to a yes, space equivalent sign, a space, opening quotation, yes, just like that, closing quotation, then you can close the calculate function. So the moment you actually hit enter there, you will have the result on this part here, which is postpartum readmission count. So hit on a card there, then you can now drag the postpartum readmission count into the card, and it will actually show you the number of mothers who were readmitted because of postpartum complications. Now I would actually want us to check on the percentage or the rate. So this 96 actually represent what rate? So to obtain the rate, we also come to this point here for the delivery step, right click so that you can hit on the new measure there. Then we backspace and say postpartum readmission rate. So postpartum readmission rate, yes, like that, space equivalent sign a space. So in this point, we are now dividing the postpartum readmission count by the total number of rows inside that deliveries table. So we are dividing, so divide, then we actually open. What are we dividing? So this measure here. So for the measure, we just insert the square bracket and you will get all the measures here. So that's actually the postpartum readmission count. So postpartum readmission count is actually here. So we are dividing the postpartum readmission count by the total number of rows inside the deliveries table. So to obtain the total number of rows inside the deliveries table, we basically use the count rows function. So count rows like that, then deliveries. Then I just have to hit on deliveries there. I close the count rows function. Then the alternate result is basically equivalent to a 0. Then I close the divide function, hit enter on the keyboard, and I'll have a new measure there, which is basically the postpartum readmission rate. So if I click on a card again, I have a chance now of dragging the postpartum readmission rate into that card, and it's basically equivalent to 0.09. You can just click on that measure there, get yourself into the measure tools tab, formatting group. Then in this point here, hit on what you call the percentage. So it will be 9 point something or 8 point something. So 8.73%. So this is basically the postpartum readmission rate. Now I would actually want us to check on the postpartum readmission rate based on the different demographic groups, so that we can actually see the groups which are actually more risky when it comes to postpartum readmission rate, so that we can actually give some focus on the group so that we can reduce this postpartum readmission rate. So what you can actually do, allow me to actually hit on a stacked column chart like that. I'll bring this one here, then drag it down like that, then also expand to the left. So in this point, I want us to check on the postpartum readmission rate by the ethnicity. So drag the ethnicity into the x-axis. Then we can now drag the postpartum readmission rate into the y-axis. So scroll up there so that you can actually see the postpartum readmission rate. It's actually here into the y-axis like that. And this is it. Majority of the mothers who are actually being readmitted because of postpartum complications are actually the black mothers, because they have a postpartum readmission rate of 11.21%. And the minority of the mothers who are actually being readmitted because of postpartum complications are actually the white mothers, because they actually have the least rate there, which is actually postpartum readmission rate of 5.68%. They actually have the shortest column. Clearly, we can actually say that the postpartum readmissions are actually more common with the black mothers as compared to these other races. So that's all about the postpartum readmission rate by ethnicity. So the black mothers, followed by the Asian mothers, Hispanic, others, and white mothers. I would also want us to check on the postpartum readmission rate by education level. So we have the education level down here inside the mothers table. So what you have to do, we can hit on a bar chart. So I can just click on one bar chart there, which is actually this one. So bring it to this point here. Then drag it up like that, so that you can also drag it to the right. The postpartum readmission rate by education level. So what you have to do is to drag the education level into the y-axis. So education level into the y-axis like that, and into the x-axis we'll basically drag the postpartum readmission rate. So scroll up there so that you can now check on the postpartum readmission rate, drag it into the x-axis like that. And now you can check that majority of the mothers who are actually being readmitted because of the postpartum complications are the mothers with the college education level. So this basically means that postpartum readmission is actually more common when it comes to the mothers with college education level. And it's actually the least when it comes to the mothers with the bachelor's degrees, because they actually have a postpartum readmission rate of 6.93%. And for the mothers with the college education level, the postpartum readmission rate is actually 12.13%. So the postpartum readmissions are actually more common with the mothers with college education level. Remember what we actually said in this point here. We actually said that when it comes to the races, it's actually more common with the black mothers. And on this point, it's actually more common when it comes to the mothers with college education level. I would also want us to check on delivery mode. Does the delivery mode actually has an impact on the postpartum readmission rate? Because we might be having the mothers who actually delivered through C-section to be having a larger count when it comes to readmission. So I would actually want us to check on that. Because they are basically two, I would actually want us to use this pie chart here. So I'll actually drag it to the center like that. Then I expand it, then drag it to the right. And yeah, that's it. Now in this point, drag it down there. Now in this point, we are going to drag the delivery mode into the legend. So that we can also drag the delivery mode into the legend there, so that we can also drag the postpartum readmission rate into the values. Now you can actually check that the postpartum readmission rate is actually more common when it comes to the mothers who actually delivered through vaginal delivery mode. So that's it. They actually have a count of, I can actually click on it, they have a percentage of 52.22%. So apart from the delivery mode, I would actually want us to actually focus on the age. So for the age, allow me to actually remove that. And we can also bring in another column. Yes, like that. Then expand. Allow me to expand this. So this part to drag it like that. Then drag it up there. And on this point, I will actually drag the age bands into the x-axis, so that on the y-axis we'll basically be having the postpartum readmission rate. So postpartum readmission rate, drag it into the y-axis, just like that. In this point, we can actually come up with a conclusion that the postpartum readmissions are actually more common when it comes to mothers whose age group is actually 20 to 24, and mothers whose age group is also 25 to 29, because for 20 to 24, they have a postpartum readmission rate of 11.11%, and for mothers with 25 to 29 years, they have a postpartum readmission rate of 10.91%. So these are the two mothers or the two groups which actually have the highest readmission rate. That's the highest postpartum readmission rate, 11.11% and 10.91%. And mothers who are actually aged 15 to 19 years have the least postpartum readmission rate of 5.19%. We have checked it based on the age, based on the education level, based on the race. I would also want us to check it based on the income group. That's the income group there. So I'll actually hit on a pie chart there, then drag it up. So on this point, I drag it down again. I also drag it up there. I drag it to the right in this case. I drag it to the right in this case, like that. And that's actually done. So I'll actually drag the income group into the legend. So income group into the legend. Scroll up there. We have postpartum readmission rate into the values. Just like that, and it's basically done. So when it comes to the postpartum readmission rate by age group, you can basically check that this blue one is actually the highest. So mothers who are actually having the high income, or mothers from the high income group, are actually at a more risk when it comes to postpartum readmissions, because they actually have the highest count, and this actually represents 38.73%. Mothers who actually earn the lowest income, or the low income group, are actually having the lowest postpartum readmission rate of 28.7%. So basically, that's how you can always identify the groups which are actually more risky when it comes to postpartum readmissions. So the postpartum readmissions actually show that there is a gap in care, and reducing them will actually improve the quality. You can actually try to reduce in terms of planning well for the discharge. So to actually guard the reputation for the hospital, you have to try all means possible to actually reduce the postpartum readmissions. In this point, I want us to check on the birth outcomes and neonatal health analysis. So we'll basically check on the preterm birth rate and the low birth weight rate. So we'll basically start with the preterm birth rates. It's actually inside the infants table. So we actually go into the table view there, then click on the infants table. Then basically you will check on the preterm status. So you can actually check that we have the preterm, the preterm, the preterm, preterm. So I would actually want us to obtain the preterm birth rates. Then after focusing on the preterm there, we'll also come to this point here so that we can obtain the low birth weight rate. So for the low birth, in terms of weight, you can actually check that we have that 117 there to be the median. It was actually our median, and you can actually check that we have the weights here in terms of grams. So that 589 is basically 3.5 kgs. So I want us to actually count preterms here so that you can now obtain the count. Then after obtaining the count, we can now use that count to obtain the rate, because we'll actually say the count divided by the total. So for the preterm birth rate, allow me to also come to this point here. So for the preterm birth rate, we have to introduce a measure there. So right click inside the infants table there, then new measure, and we'll actually say the preterm count. That is the preterm count. Yes. So preterm count, just like that, space equivalent sign, a space. So we'll basically say calculate, then we introduce the count rows function like that, then open. We are basically inside the infants table. So infants, then you just have to click on it like that. So calculate the number of rows inside the infants table, where the column preterm status is actually equivalent to preterm. So where the column preterm status is equivalent to preterm. So preterm status is basically a column inside the infants table. So infants, then you select the preterm status. It must be equivalent to, that's a space, equivalent sign, a space. It must be equivalent to opening quotation, preterm. Just like that, closing quotation, then you basically have to close the calculate function. So the moment you hit enter on the keyboard, we'll have a measure inside the infants table. Inside the infants table, because that's where we had actually gone to create the new measure there. So allow me to actually hit on a card. Then after hitting on a card, drag the preterm count into the card, and you can actually check that we have a total preterm count of 702. So to obtain the rate, it's actually very simple again. So for the rate, we'll also go into the infants table there, right click. Then after right clicking, new measure there, preterm birth rate, just like that, space, equivalent sign, a space. So we'll say divide, we are dividing, then opening bracket, then a square bracket, so that you can use this count. So a square bracket, then you actually have to look for that count. Scroll down there to where we basically have the preterm count. So this is it. So we are dividing this preterm count by the total number of counts when it comes to the preterm status. So count rows. So the total number of items inside the preterm status is basically equivalent to the total number of rows inside the infants table. So infants table, then you actually click on the infants table there. Then you actually close the count rows function. Alternative result is actually equivalent to a 0. That's in case of an error, just have a 0 there. Then you close the divide function. Then you hit enter on the keyboard. So we'll basically have the preterm birth rate. So hit on a card again. Then after hitting on a card, allow me to also drag the preterm birth rate into the card. So for the preterm birth rate, it's actually equivalent to 64%. So in terms of percentage, you can actually click inside the new measure there, measure tools tab, then formatting group here, then hit on the down arrow, then hit on the percentage. It's basically equivalent to 64 or 63.82%. So this is basically our preterm birth rate. 63.82%. It's actually high. So what factors actually make this rate to be too high? That is actually 63.82%, which is close to 64. So what factors are actually pushing this rate? So I want us to actually analyze this by age, by race. We also check on the smoking status. We also check on the different factors so that we can actually make a conclusion that this and this factor strongly pushed the preterm rate up there. So basically we will actually start on this part here. That's for the mothers. We'll actually do the age, the education level. We also check on the income, insurance, pre-existing conditions, on the race, and on the smoking status. So these are actually what we'll consider. So what we'll actually do in this point, I want us to actually use a matrix for nearly all of them. So I'll hit on the first matrix there, and that's it. Allow me to actually bring it to this point here. So on the first one, we'll actually have the age. So drag the age into the rows like that. Then the next item is to drag the preterm birth rate into the values. So look for the preterm birth rate. It's actually here. Preterm birth rate, it's actually here. So drag it into the values like that, and you can actually check that this is the distribution. So I want us to do for the age, then education level. So I had actually wanted us to use the matrix for all, but we can actually shift to the column chart there. So in this point here for the column chart, to the x-axis, we'll actually be having the education level. So drag the education level into the x-axis like that. Then preterm birth rate into the y-axis there. And that's what we have basically. And the next one, I want us to have all of them first so that we can do the analysis. So the next one will actually be the bar chart. So I'll actually click on the bar chart like that. So income group into the y-axis like that. Then into the x-axis, we'll actually be having the preterm birth rate. So drag the preterm birth rate into the x-axis, and that's it. I want us to also consider the insurance type. Then we also check on the parities. So let's check on the insurance type. So for the insurance type, in that case, allow me to actually use a different item, which is actually this one here. So basically, I'll click on it like that. Then after hitting on it like that, drag it to this point here. Then allow me to actually expand it. So this is basically a line chart. So for the line chart, on the x-axis will basically be having the insurance types. So insurance types on the x-axis like that. Then on the y-axis will basically be having the preterm birth rate. So preterm birth rate into the y-axis. Done. And we can also have a matrix. So allow me to actually click on a matrix like that. Then after clicking on a matrix, I'll actually bring it to this part here. Then we will expand it like that. Then in this case here, we have already seen the age, education level, the income group, the insurance. Then the other big factor here can actually be the race. And then we also check on the smoking status. So for the race, we'll basically drag the race into the rows like that. Then we basically have to drag the preterm birth rate into the values. So scroll up there, preterm birth rate into the values, just like that. And that's actually done. The other one, we can also use the matrix for the remaining two. So this one here, so we'll basically drag it up there. Then we just expand it like that. And I think that's actually okay. So in that case, we'll actually be dragging the smoking status into the rows. So drag the smoking status into the rows. Then you basically drag the preterm birth rate into the values. So preterm birth rate into the values. So scroll down here. Then preterm birth rate into the values. And we basically have about we basically have about 6 factors here. This one is actually for the smoking status. This one is actually for the age. This one is for the race. This one is for the insurance type. This one is actually for the income group. And this one is basically for the education level. I think we can now come up with one last one, which is basically for the parity. So for the parity, I'll actually hit on the matrix there. Then bring it to this part. Then try to expand it upwards. And I'll actually drag the parity into the rows. So we add a parity of 0, 1, 2, 3, 4. So drag the parity. It's actually here. Drag it into the rows like that. Then scroll down there so that you can also drag the preterm birth rate into the values. Now it's our turn to actually come up with the conclusions and see how we can actually come up with some meaningful data from these visualizations here. So first of all, when it came to breaking down this preterm birth rate based on the smoking status, so when it comes to the smoking status, for the mothers who are not actually smoking, the preterm birth rate is actually equivalent to 63.32%, and the mothers who actually smoke have their preterm birth rate at 67.13%. So you can actually check that the smoking status actually affects the preterm birth rate. It actually increases the preterm birth rate because the mothers who actually smoke are actually having a rate which is actually too much high. Allow me to also check on the age. So we'll actually check on all of them before we now come up with a conclusion on which one actually affects it higher, because we would actually want to check on the ones which strongly affects the preterm birth rate. It might be actually affecting the preterm birth rate, but the one which actually affects it higher will actually want us to have some intervention. So I want us to actually focus on them. So for the mothers who actually have their age group to be between 20 to 24, they will be at a risk of going preterm. So you can actually check that as the mothers actually approach 40, the preterm birth rate actually decreases, because this one is actually 60.71. This one was 64. We add 61. We add 66. And 20 to 24 is actually the age group with the highest preterm birth rate. We can't actually say that an increase in the age actually increases the preterm birth rate. No, because this one is actually affecting one age group. You can actually check that it's actually this one for 20 to 24 being 70.18. So we cannot actually conclude for all of the mothers here that an increase in age actually leads to an increase in the preterm birth rate. No, it's not actually that case. This one is actually master's, college, bachelor's, and high school education level. So for the high school education level, the preterm birth rate is actually higher, and for the master's education level, the preterm birth rate is actually lower. So we can actually conclude that education level actually affects the preterm birth rate, because as the level actually goes higher, the birth rate actually decreases. So allow me to also get into the report there. And in this point here for the income, allow me to hit on the focus mode. Inside the focus mode here, you can actually check that mothers who actually have high incomes, or mothers inside the high income group, are the ones who are actually having the high preterm birth rate, 64.84%. And for the low income group, we have 64.68%. And for this part here, we have, that's for the medium income group, we have 61.82%. In this part too, that's for the insurance type. Allow me to hit on the focus mode there so that you can check on this. So for the insurance types, you can check that for Medicare insurance, the preterm birth rate is the highest, 65.97, followed by the uninsured mothers. Preterm birth rate is actually 65.50%. Followed here by the private insured. The preterm birth rate is actually 64.89%. And in this point here, we have the unknown insurance. It was not actually indicated, insured, but not actually known. So preterm birth rate is actually 63.07%. And finally, for the Medicaid, the preterm birth rate is actually 60. Medicaid is actually having the least preterm birth rate. So let's also check on the ethnicity. So for the ethnicity, you can clearly check that the other ethnic groups are actually leading when it comes to the preterm birth rate. They have 69.91%. It's actually the highest one here, because the second one is actually 65 and 65. So the highest one is actually 69, and the blacks are actually having the least preterm birth rate. That stands at 57.40%. And for the parity, I can also hit on the focus mode there, and you will actually check that mothers with a parity of 4 have the highest preterm birth rate of 66.05%, and the mothers with the lowest preterm birth rate are the ones who have a parity of 3, 59.19%. So I want us now to actually identify at least 2 items or 2 factors which highly affect the preterm birth rate. At least 2 factors which highly affect the preterm birth rate. First of all, we'll actually start with the smoking status, because we actually saw that there was a big difference between the mothers who do not actually smoke and the mothers who actually smoke. So for those who don't actually smoke, it was 63.32%. For those who smoke, 67.13%. So clearly you can check that mothers who smoke are actually having the highest preterm birth rate. So smoking status actually affects the preterm birth rate. So that's it. We can also conclude that the education level actually affects the preterm birth rate, because this one is actually master's and this one is actually the high school education. So we can actually say that there's a correlation between the education level and the preterm birth rate. The other ethnic groups have the highest preterm birth rate of 69.91%. So they are actually the highest affected when it comes to the preterm birth rates, 69.91%. And the least affected are actually the blacks. So we can conclude that the black mothers actually have the least preterm birth rate. So when it comes to the factors which highly have an impact on the preterm birth rates, we'll actually start with the smoking status. Then we also go to the education level. Then we also go to the race or ethnicity. Then you might also try to consider the parity. But the highest ones will actually be the smoking status, the education level, the race or ethnicity. Then you can also consider the parity. So I want us to also come up with a low birth weight rate. So what you have to do is to get ourselves into the table again, which is basically this table here for the infants. That's where we basically have the birth weight in terms of grams. So right click on it, then hit on new measure there. Then we'll actually call this one the low birth weight count, just like that, space equivalent sign a space. So we'll actually say calculate, yes, then open count rows, that's inside the infants table. Then we actually close where, yes, where the column in the birth weight grams less than 2.5 kgs. So that one will actually be low birth weight. So this birth weight is actually inside the infants table. So infants like that, then select birth weight in terms of grams. So it must be less than 2500 grams. Yes. So if it's actually less than 2500 grams like that, then you basically have to close the calculate function. So we are counting the number of rows inside the infants table, where the birth weight in terms of grams, that is, this is actually a column containing the weights for the infants, is actually less than 2.5 kilos. 2.5 kilos is actually 2500 in terms of grams. So remember, the column is actually in terms of grams. That we are in terms of grams. That's why we are actually having this one to be in terms of grams, 2.5 kg. So the moment I actually hit enter there, we'll actually be having the low birth weight count. And I want us now to also have the low birth weight rate. So right click there, then you hit on new measure. Then after hitting on new measure there, we'll actually say the low birth weight rate, just like that, space equivalent sign a space. Then we actually say space, then we actually use divide like that, then open the bracket, square bracket there. Then basically we are dividing the low birth weight count by the total number of rows that we have inside this infants table. That's it, very simple. So we have to hit on the low birth weight count like that, yes, divided by the count of rows. That's actually the total number of rows inside the infants table. So infants like that, then you have to click on that table like that, close. Then alternative result is actually a 0. You close the divide function, hit enter on the keyboard, then you will basically have the low birth weight rate. So allow me to also hit on a card there, and we'll basically have the low birth weight count. Drag it in there, and we have 222 to be the low birth weight count. That's the number of count for the low birth weight. We can also have a card for the low birth weight rate. That's the low birth weight rate into the card there, and you can actually check that it's actually 0.20, which is basically equivalent to approximately 20%. So measure tools tab there, formatting, format, convert that into percentage, and it will be something like 20.18%. So I would also want us to actually check if we actually have some maternal factors which actually affect the neonatal outcomes. That is the preterm birth rate and the low birth weight rate. I want us to check on what you call the predictive risk analysis. So for the predictive risk analysis, we'll actually be checking the risk based on the age, the risk based on the pre-existing conditions, and the risk based on the smoking status. We are on this column here, which is actually for the mother's column. So we are doing the risk based on the age. Then we go down here, the risk based on the pre-existing conditions, and finally the risk based on the smoking status. So it's basically inside the mother's table. So I can actually hit on the table view there. So in this part here, you can check that we have the smoking status, pre-existing conditions, and also we have the smoking status. So this is actually the smoking status. So I want us to predict the risk. So if the age is actually greater than that 5, then the risk should be 4. And if it's less than or equivalent to that 5, the risk should be equivalent to a 0. If the pre-existing condition is actually equivalent to none, then the risk should be 0, because we do not have the pre-existing condition. So if the pre-existing condition is equivalent to none, then the risk should be 0. If it's not equivalent to a none, the risk should be 4. And finally, for the smoking status, if the smoking status is equivalent to a no, the risk should be a 0. If it's equivalent to a yes, the risk should be 4. So finally, we will obtain 4 plus 4 plus 4 to be the return, and it will be equivalent to 12. So that's it. Now, we can actually do that prediction so that we can actually see a score of 8 or a score of 12 or even a score of 4 or a score of 0. So we can just come to this point here, that is add a new column here. So to add a new column, we have to get ourselves into the table tools tab there. Then we basically have what you call the new column. Click on the new column there, and basically you will actually check a new column inserted there, which is actually column. And in this point, we'll actually call that one the maternal risk. So maternal risk like that. space, equivalent sign, a space. Then we actually hit shift enter on the keyboard so that we can actually go to the next line. So inside the next line, we have a variable. So we are basically introducing a variable. So the variable is basically the age risk. So the age risk, space, equivalent sign, a space. So the age risk. So if the age, which is basically inside the mother's table. So if the age, which is basically inside the mother's table, use this age here, which is actually for the column. Do not actually use the bins. So if the age is basically inside the mother's table is greater than or equivalent to that 5, then I have the output to be equivalent to a 4. Otherwise, the output should be equivalent to a 0. Otherwise means if it's less than that 5, the output should be equivalent to a 0. Just like that. You just have to close the if function there. Hit shift enter on the keyboard again. So variable number 2, that's after the age, we have the next one to be the pre-existing conditions. So if the pre-existing condition, yes, so if the pre-existing condition, so if the pre-existing condition, which is basically inside the mother's table. So inside the mother's table, we have the pre-existing condition. It's actually down there. So if the pre-existing condition is not equivalent to none, that is not equivalent to none, yes, that means we have not equivalent to none can actually mean asthma, hypertension, diabetes, like that. Then we have to give a risk score of 4. So if it's not equivalent to none, then comma, we are giving a risk score of 4. Otherwise, that means if it's equivalent to none, we are giving a risk score of 0. Shift enter on the keyboard again. Variable. The next variable is basically the smoke risk. So smoke risk, like that. So if the mother is actually smoking, then the risk score should actually be equivalent to 4. Otherwise, it should be equivalent to a 0. Equivalent sign, a space. So smoking status is basically inside the mother's table. So scroll down there to where we have the smoking status. So scroll down there and you can actually check that you have the smoking status. So if the smoking status is equivalent to a yes, like that, yes, then a comma, the output should be equivalent to 4. Otherwise, it should be equivalent to a 0. Otherwise means if the smoking status is actually equivalent to a no, then the output should be equivalent to a 0. Remember, we are not actually having the quotations inside 4 and 0 because 4 and 0 are basically the numbers. We do not always have the quotations inside the numbers, but the quotations actually belong to the text. So that's it. So just have an if there. That is, if the smoking status is a yes, then the score should be 4. Otherwise, 0. Otherwise meaning if the smoking status is actually no. Shift enter on the keyboard and we will actually be on a new line. So we are now supposed to return the total, which is basically the age risk 4 plus the count risk, which is actually 4 again, plus the smoke risk, which is also 4. So in that point, we'll actually say age risk, like that, which is actually this one here, space plus space. The next one is actually count risk, which is actually the pre-existing conditions. I actually wrote it like this so that I can actually avoid the hyphens. So this one is actually count risk. So count risk, like that. You click on it like that. Space plus space. On this part, we have the smoke risk. So smoke risk, and that's it. So for a mother who is actually greater than or equivalent to that 5 years and also has a pre-existing condition to be asthma, hypertension, diabetes, or something else, and the smoking status is a yes, then we actually expect a score of 12. And for the mother who is actually having age of less than that 5, and the pre-existing condition is actually none and the smoking status is actually a no, then we expect a return of 0. So the moment I hit enter there on the keyboard, check what we actually do have on the maternal risk. On the maternal risk, you can actually check that we have 4, we have 8, like that. Scroll down there and let's also check if we have sum of 12. I can click on this button here so that you can check. Now you can also check that I have up to 12. So we have mothers who are totally exposed to risk. And we have also mothers who have a risk of 8. That's a score of 8 out of 12. This one is actually a score of 4 out of 12. And this one is also a score of 0 out of 12. So what you can actually do in this point so that you can actually identify the hospitals which actually have mothers prone to this high risk. So to actually do that, we can count the number of mothers who are actually having a maternal risk of 12, and that one will be the high risk mothers. Then we also see the mothers who are actually having a maternal risk of 0. It's actually very possible for us to actually do that. So what you have to do is to come to this point again. That's for this mothers table here. Then you actually right click. After right clicking there, we actually hit on a new measure. Then you actually say count of high risk mothers. So count of high risk mothers, just like that, space equivalent sign a space. So we are going to use the calculate function plus the count rows function. So calculate plus count rows function like that, and we are basically counting the rows inside the mothers table, because that's where we have the maternal risk column. So it's basically inside the mothers table, and the column must actually be equivalent to 12. So that column maternal risk is actually inside the mothers table. So maternal risk column, you can check, it's actually inside the mothers table. So maternal risk is basically inside the mothers table. So you just have to click on it like that, space equivalent sign a space 12. We are not actually having that 12 inside the quotations because it's a value, it's a number. So, and close the calculate function. So we are basically obtaining the total number of rows inside the mothers table, where the column maternal risk is basically having a number equivalent to 12. So those ones will be the high risk mothers. So we are basically obtaining the count of high risk mothers. So hit enter on the keyboard and you will basically have the result there. So allow me to also copy this. Then after copying that, I can just come to this point again for the mothers table. Then we hit on right clicking there, then hit on a new measure. Then we'll also do the count of low risk mothers. So in this point, I'll hit Ctrl V. We can just write again. So count of low risk mothers. So the count of low risk mothers, space equivalent sign a space. So calculate plus count rows. So calculate then count rows function. Remember, the calculate function actually brings in the aspect of where. So count rows in the mothers table, inside the mothers table, where the column, and that column is actually inside the mothers table, where the column is basically equivalent to, we can say 0, just like that, and I close. So we are counting the low risk mothers. So count of low risk mothers, then counting the number of rows in the mothers table, where this column here, which is actually the maternal risk column, which is basically inside the mothers table, is equivalent to a 0. So that one will be the count of low risk mothers. And those two can actually be very important in our case. So allow me to also come to this point here. Then I hit on two cards. I'll actually click on one like that. Then select, hit on Ctrl C to copy, hit on Ctrl V to paste. So I basically have two cards there. I'll drag one to the right. Then count of low risk mothers to the second one. So I'll actually click on the second one. Then I just hit on count of low risk mothers. Go to the first one. I'll click on it like that. Then come to this point, count of high risk mothers. So the count of high risk mothers is basically equivalent to 43, and the count of low risk mothers is basically equivalent to 111. So allow me to break down the count of high risk mothers based on the race or ethnicity, so that you can actually see the race which is actually having the highest risk when it comes to the pregnancies, and also check on the race which is actually having the lowest risk. So what you have to do is to hit on a matrix like that. Then after hitting on a matrix, you can actually check that it's selected. So that's okay. So I'll come to this point and tick on the race or ethnicity. Then I also tick on the count of high risk mothers. And basically, I'll hit on the focus mode there. So you can actually check that the race which is actually having the count of high risk mothers is actually the others and the blacks. So the blacks also have 10. And the race which is actually having a count of high risk mothers to be low is actually the white mothers. So that actually means that we have to give a lot of attention when it comes to black mothers and the other races. You can also come to this point here for the low risk and hit on a matrix, so that you can actually check on the spread and hit on the matrix. Then after hitting on the matrix, you can basically drag in a different item, which is, we can see the race. I'll actually check the race there again, and you can actually check that the low risk mothers, we have the leading race being the Asians. So the Asians basically have the highest count of low risk mothers. And you can also check that in this point here, when we are actually doing the count of high risk, the Asians are also doing good because they had the lowest count, one of the lowest counts, because the lowest was actually for the white mothers and the second lowest was actually for the Asians. So the Asians actually had the second lowest when it comes to the count of high risk mothers. And in this point too, you can also check that when it comes to counting the low risk mothers, it's actually the leading with 27. That actually means that the Asian mothers are actually having the lowest risk generally. So that's all about the predictive risk analysis. In this point, we'll actually check on the median and distribution analysis. So we'll basically check on the median values for the key health indicators. Like in this point here, you can actually check that in the first column, we'll actually be obtaining the median for the length of stay days. Then we also come to this point here for the infants table. We will also obtain the median for the length of NICU stay days. Then for the mothers table here, we won't actually obtain anything there. Then in this part here for the pregnancies, we'll basically obtain the median for the gestational age, that's in weeks. And I don't know if we also have something else. We'll also obtain the median for the prenatal visits count. So we already obtained this before, that is the median for the prenatal visits count. So allow me to actually start with the length of stay days. So length of stay days. So what you have to do is to get into the deliveries table there, right click, then we hit on the new measure there and indicate that we are basically obtaining the median for the length of stay days. So backspace there, median for length of stay days. So we can call it lost. So length of stay days is basically equivalent to, then we basically use the median function. So median, then you actually open, we are dealing with the deliveries table. So inside the deliveries table, we are basically obtaining the median for the length of stay days. So inside the delivery table, we are basically obtaining the length of stay days. That's the median for the length of stay days. Then I close the median function like that. I have to hit enter on the keyboard. Then we will have a measure there called LOSD, lost. So median for the length of stay days. So in this case, allow me to actually hit a card like that. Then after hitting on a card, I can drag this median LOSD into the card there. And the median of stay days is basically equivalent to 4 days, just like that. So remember, when it comes to the healthcare analytics, we always prefer to use the median over the average, because the median is actually more realistic and it will actually help us to identify the abnormal patterns that actually require investigations. In this point here, we can also obtain for the median of birth weight in terms of grams. So for the median here, what you have to do is get ourselves into the infants table there, right click, then hit on the new measure there, then wait for it to actually load, and we'll actually call this one the median BW. So median birth weight, we can just have it as birth weight be equivalent to, so we have to use the median function, then open. We are basically inside the infants table. Yes, and inside the infants table, we are actually working on the birth weight column. So in this point here, we have to type infants like that so that we can obtain the birth weight in terms of grams. That's actually the column. So I just have to close the median function like that, and that's actually done. I hit enter on the keyboard. So I'll obtain the median birth weight there inside the infants table as a measure. Then I have to hit a card there. Then after hitting a card, I can just drag the median birth weight into the card there. And I have 3.12K. That is basically equivalent to that 120. So that's the median birth weight. So 3.12K in my case here, because we are actually dealing with the grams, this one will be that 120 grams. Because 3.12K is basically equivalent to that 120 grams, which is basically equivalent to 3.12 kilograms. So the other item in this point here is obtaining the median for the maternal age. Remember, we had actually obtained the average, which is actually the average maternal age. Now for the median maternal age, what you have to do is to right click inside the mother's table there. Then we hit on the new measure. Then we basically say median age or median maternal age. That's actually the same thing. So median maternal age. like that, space, equivalent sign, a space, then we basically have to use the median function. So median like that, we are basically working on the age, and the age is actually inside the mothers table. So mothers like that, then you have to select the age. Do not select the age in bins, select the column itself, just like that, and you close the median function, hit enter on the keyboard, and you will have the median maternal age. This is it. So what you have to do is to click on a card like that. Then after hitting on a card, we can just drag the median maternal age into the card. So we have that 2.00. That's actually the median maternal age, 32 years. What actually remains in this point is the median gestational age. So scroll down there, and you'll basically check on the gestational age in terms of weeks. So right click on the pregnancies table there. That's where we would actually want to have our new measure, and we'll actually call it median gestational age. So remove that and have median gestational age. Yes, space, equivalent sign, a space, then we basically have to use the median function like that. Then this is basically inside the pregnancies table, and you are working on the gestational age weeks column. So pregnancies table, we are working on the gestational age weeks column, and it's actually this one here, not the one in the bins. It's actually this one here, because this one is the column itself. So I'll actually click on that column, then I close the median function, then I just have to hit enter on the keyboard, and we will have the median gestational age in weeks inside the pregnancies table. That will be a measure inside the pregnancies table. So allow me to actually scroll down there so that I can actually show you. It's actually here, the median gestational age. So I can actually click on the card there. Then you can basically have the median gestational age into the table there. So we have the median gestational age to be equivalent to 32 weeks. So this is the age in terms of weeks. So 32 weeks. But this one is actually the median maternal age. So it's actually 32 years. And this one is actually the median birth weight, 3.12 K, which is basically that 120 grams or 3.12 kilograms. And this one is actually the median length of stay days, equivalent to 4 days. In this point, I want us to check on the hospital comparison analysis. We'll be checking on the NICU admission rates in every hospital. We'll also check on the readmission in every hospital. And finally, we will also check on the C-section rate in every hospital. So remember, in this point here, we actually have different hospitals. I can actually show you the hospitals. You can check that in this point here, we have what you call the hospital name inside the deliveries table. So I can come to this point here for the table view. Then I hit on the deliveries table there. Then we basically have what you call the hospital name. You can check I have the University Hospital, Regional Hospital, City Medical Center, Metro Health, Regional Hospital, General Hospital. Scroll down again so that you can see if we have a different one. So you can actually check that we have, I can just use this filter button there. So we basically have the City Medical Center Hospital, General Hospital, Metro Health Hospital, Regional Hospital, and University Hospital. So basically you can check that we have 5 hospitals. So I want us to compare the C-section rate for all those hospitals. So in this part here, remember we had the C-section rate, but this one was actually for the total data. This was not actually based on the individual hospital. This was for all the hospitals. So in this part, you can actually say we are obtaining the C-section rate for a certain hospital, and we'll basically start with this one here. We can actually start with the City Medical Center Hospital. So City Medical Center, just like that. So I'll come to this point here for the deliveries table, right click, then hit on the new measure, and we'll say C-section rate, City Medical Center. So C-section rate, City Medical Center, then space, equivalent sign, space. So that one basically will be equivalent to, so we'll have to use the calculate because we already have the rate. So we'll now say we are obtaining this rate where the hospital name is basically equivalent to City Medical Center. So calculate like that, then opening square bracket. In this point, we'll be having the C-section because it's already a measure. So you just have to insert the square bracket, then you will have the C-section rate, comma, that is where the hospital name is equivalent to City Medical Center. So where do we have the hospital name? It's basically inside the deliveries table. So delivery is table there, so that you can actually pick on the hospital name. It must be equivalent to City Medical Center. Just like that, close the quotation. That's for the City Medical Center. After closing the quotation there for the City Medical Center, we can also close the calculate function. So you just have to hit enter on the keyboard, and that will be it. Now we have the card there for the C-section rate, CMC, City Medical Center. So I can basically click on a card there. Then I have to drag this C-section rate, CMC, which is basically the C-section rate for the City Medical Center. I can just click on it like that, and we have 0.43. So come to this point here, click on the measure there, then measure tool stop, formatting group here. Then I have to select percentage. It will be 42 point something or 42.93%. So basically that's how you can actually use a measure to come up with the C-section rates by the hospital name. So remember, we can also go and do the next one again for the general hospital, for the university hospital, just in the same way we have actually done for the CMC. In the same case, we can basically drag or hit on a matrix there. Then after hitting on a matrix, allow me to have it there, I'll actually tick on the hospital name. Then I'll also tick on the C-section rate, that is the hospital names and the C-section rates, so that I can obtain the C-section rate based on the hospital name. Now you can actually check that for the City Medical Center, we have 42.93%, which is basically what you actually had there. City Medical Center is actually 42.93%, General Hospital 49.38%, Metro Health 55.26%, Regional Hospital 43.15%, and finally the University Hospital is actually 61.69%, and a total or average C-section rate is basically 51.18%. You will actually allow me to have this one here. Then we can actually represent this by using a bar chart. So I'll actually click on a bar chart like that. I can actually expand, then I also drag it. The y-axis will basically be having the hospital names. So hospital names to the y-axis like that. Then to the x-axis will basically be having the C-section rates. Just like that, and we now have a visualization for the C-section rates by the hospital name. So we have the matrix here, and this is a big visualization for that. So I can just drag it like that. So this is now the C-section rate by the hospital name, and you can actually check that for this hospital here, which is basically the university hospital. The C-section rate is actually too high, or it's actually the highest, at 61.69%, followed by the Metro Health Hospital, which has a C-section rate of 55.26%, followed by the General Hospital, which has the C-section rate standing at 49.38%, followed by the Regional Hospital, which has the C-section rate standing at 43.15%, and finally at the City Medical Center, which has the C-section rate standing at 42.93%. So this actually means that we have to address the cases of the C-section when it comes to the University Hospital, because it actually has the highest C-section rate. The C-section rate is actually risky, and it might actually end up killing the reputation for the hospital. So the more you minimize the C-section rates, the more you are actually going to build the reputation for the hospital. So that's it. So we actually need to go to this hospital here and reduce the C-section rates so that we can actually try to build the reputation for the hospital. So that's it. Now I want us to check on the NICU admission rate. You can actually check that in this part here. I'll actually scroll down. We basically have what you call the NICU admission rate. So I'll hit on page 2. I'll click on the new page there. This is actually page 1. And for the page 1, we are actually done with the C-section rates. So in this part here, we'll basically do the NICU admission rate by hospital. Before we actually go into using the matrix, I'll also show you how we can actually use a measure. So we'll actually go with the CMC, which is basically the City Medical Center. So right click on that table there, which is actually the infants table. Then hit on the new measure. Then we have to backspace and call it the NICU admission rate in CMC hospital. That is the NICU admission rate in CMC, which is basically in City Medical Center, or NICU admission rate CMC. Just like that, space equivalent sign a space. So in this point, we'll actually use the calculate function like that. Then I open it a square bracket there. So we are actually obtaining the NICU admission rate where the hospital name is actually equivalent to the City Medical Center. So remember, we actually add the NICU admission rate for all these hospitals. Now we'll actually be doing the filtering that is based on the hospital name, which is actually the City Medical Center. So what I have to do is to come to this point here, calculate NICU, that is where the NICU admission rate comma, where the NICU admission rate actually belongs to city medical center. So hospital names are actually inside the deliveries table. So we come to this point again and say deliveries like that. So where the hospital name, which is actually this one here, is equivalent to city medical center. So opening quotation, city medical center. Just like that, close the quotations there and close the calculate function. So we are obtaining the NICU admission rate where the hospital name is actually equivalent to city medical center. So the moment I actually hit enter there, we'll actually be having the NICU admission rate CMC hospital. So what I can actually do in that point is to hit on a card. Then after clicking on a card, I can actually drag the measure into the card there, or just click on it like that, and you can actually check that I have 0.18. So I can click on it there, measure tools tab, formatting group here, then select percentage. So it will be 17 point or 18 point something. So 17.93%. Alternatively, we can actually use a matrix. So I can actually click on a matrix there so that I can drag the hospital name into the rows like that. Scroll down there to where we basically have the NICU admission rate. Then you click on it. Now you can actually check that for the city medical center, we have 17.93%, which is basically what you actually had there when we actually used the measure. So click on the focus mode there so that you can check city medical hospital. That's the city medical center is actually equivalent to 17.93%. So in this point, we can also use a pie, a pie chart is actually okay. Click on a pie like that, and that's done. So we have actually represented that by using a pie chart. So get back to the report, and this is it. So I'll actually bring it to this part like that. So we can actually still bring the data again, that is for the matrix. So make sure you actually click outside first so that this one does not remain selected, because if it remains selected, then it will be converted to a matrix. Now we have to select the hospital name. Scroll up there, we have the hospital name, so tick on it or select it like that. Scroll down there to where we basically have the NICU admission rate. So tick on the NICU admission rate, and this is it. You can actually check that this one here is actually the largest. So I can actually click on it so that you can see the name. It will be activated there. You can check that it's actually the university hospital. So in the university hospital, we are actually having the highest NICU admission rate of 20.97, which is actually there. You can actually check it has been filtered out, or it's actually here again. It's actually 20.97. And this 20.97%, when it comes to the total, actually represents 23.36%. Now, if you actually want to go to the general hospital again, you just click on that. City Medical Center, click on it. Metro Health, click on it like that. Regional Hospital, click on it. But for the University Hospital, because it's actually having the highest NICU admission rate, then it actually means that you can actually add more resources here, or try to see where the problem could actually be. If you actually break it down like this, you'll actually identify the hospital with the highest NICU admission rates and address the NICU admission rates in that hospital individually, because it's actually carrying the highest. I would also want us to check on the readmission rate by hospital. So in this point, I can just click on this page 1 here. After clicking on page 1, you can double click on it so that you can actually edit. So this one will be the C section. That's the C section rate. Then double click on this one again like that so that you can edit. And this one will basically be the NICU admission rate. So NICU admission rate like that. For this part here, I'll actually hit on the new page and I'll actually call this readmission rate. So readmission rate. Hit enter on the keyboard. So remember, we basically have the NICU admission and we also do have the readmission rate. So for the readmissions, it's actually here. That's the readmission within the 30 days. So we can actually break down so that you can obtain the readmission rate. That's for the general data that you actually have, so that you can now come and use the measure or use the matrix to break it down. So remember, when it comes to the deliveries table, I'll actually hit on the table view there. You can check that in the readmission, we actually have no, that actually means not readmitted. Down there, you'll actually check that there were some mothers who are actually readmitted. So you can actually check that we actually had some mothers readmitted. So what you can do in this point here is to obtain the readmission rate for the general data, so that we can now break it down based on the hospital names by using either a matrix or a measure. Let's actually go up there so that we can obtain a new measure. So inside the deliveries table there, right click, then hit in this point here. It will actually be a new measure, which is the readmission rate. So we'll basically call that one the readmission rate. So readmission rate. So it will be equivalent to, so we are basically counting the number of yes inside that readmission column. So we are counting the rows containing the yes inside that deliveries table, and inside the deliveries table the column has to be the readmission column. So we are going to use the calculate function and the count rows function. So calculate like that, then I actually have to open, then count rows, then open again. Then it will actually ask you for the table here, which is basically the deliveries table. So deliveries like that, deliveries table, I just have to close. So we are counting the number of rows inside the deliveries table where the readmission within that day's column contain yes. So readmission, that column for readmission is basically inside the deliveries table again. So deliveries like that, so that you can pick on the readmission within 30 days. So deliveries table, yes, readmission within 30 days. So where the readmission within 30 days is basically equivalent to a yes. So space equivalent sign a space, then opening quotation, it must be equivalent to a yes. Closing quotation again, then you now close the calculate function. So we are obtaining the number of rows inside the deliveries table where the column readmission within 30 days is basically equivalent to a yes, and this column is basically inside the deliveries table. So just like that, and I just have to hit enter on the keyboard and I'll actually obtain the readmission rate. What I have to do in this case now is to hit on a card like that. Then after hitting on a card, I can actually go down there and drag the readmission rate into the card, or just click on it like that. Now in this point, remember we are basically obtaining the rate. It's not actually the count. So this is basically the rate, but we can also convert this one to be a count so that we can go step by step. So we can have the readmission count. So we'll be counting where the readmission within 30 days is basically equivalent to a yes. So I do not actually want to confuse you. So after that, I'll actually hit enter on the keyboard and you'll actually check that we'll have the readmission count measure inside the deliveries table there. So I'll actually click on the card, then I'll just drag or just tick on readmission count, and you can actually check that we have a total of 96 readmitted mothers. So now, how do we actually obtain the readmission count? So to obtain the readmission count, we actually say the count, which is actually the number of mothers readmitted divided by the total number of mothers who are actually discharged. So those readmitted divided by the total mothers who are actually discharged, and the total mothers who are actually discharged are the ones who were never readmitted plus the ones who are actually readmitted. So let's now come to this point here and obtain the readmission rate. So back to the deliveries table there, we have to right click on it, then we have to hit on the new measure, and we'll actually call this one the readmission rate. And when it comes to the readmission rate, we have actually said that we'll be doing the division. So readmission like that, then rate. So space equivalent sign a space. So we are basically doing the division. So divide what? So we are dividing a measure that we actually created. So you can actually use a square bracket there so that you can get all the measures that you have actually created. So all these ones are actually the measures that you have created. And in my case, we are actually interested with the readmission count. So we are basically dividing the readmission count by the total number of rows inside that deliveries table. So to obtain the total number of rows inside the deliveries table, we basically have to use the count rows function. So count the number of rows inside the deliveries table. So inside the deliveries table like that, and just close the count rows function like that. And for the alternate result, you can just have a 0 there. Close the divide function, hit enter on the keyboard, and you will basically have a new measure there, which is basically for the readmission rate. So what you have to do is to scroll down there, and you can now check we have the readmission rate. So you can click on a card there, then click on the readmission rate, and now you can check that we have the readmission rate standing at 0.09. So I can also click on it like that, then come to the measure tools tab, formatting group, then hit on this point here, then I just have to hit on the percentage, and now you can check that the percentage is 8.73. Now I want us to have this percentage. Now I want to have this representation in a column format. So we have to hit on a column. So make sure you have actually clicked outside, because if you click inside like this, it actually means that this one is activated, and the moment you actually hit on a column, it will be converted to a column. That is from a card to a column. But in my case, I never actually wanted to do that. So I'll hit on a column there, I'll select the hospital name, then scroll down there so that I can also select the readmission rate. So after selecting the two, you'll actually check that I have a column chart. Drag again to the left like that. On this part, you can as well drag to the right, drag it up there. So this is basically the readmission rate, and you can check that the hospital which is actually having the highest readmission rate is actually the City Medical Center, which actually has the readmission rate standing at 13.04%, followed by University Hospital having the readmission rate at 9.68%. So you can actually check that this one is actually big with a big margin. So from 13.04 all the way to 9.68 is actually a big margin. Then followed by General Hospital, which actually has the readmission rate at 7.82%. I can hit on the focus mode so that it can be a bit clear. Then followed by the Metro Health, which is actually having the readmission rate at 7.46%. And finally for the Regional Hospital, having the readmission rate at 6.09%. So if you actually do the comparisons, that's from the C-section rate all the way to the NICU admission rate all the way to the readmission rate, you will actually conclude that the University Hospital actually needs a lot of improvements. Why? Because it's actually leading when it comes to the C-section rate. It actually had 61.69%. It's also the leading here, imagine. So it's actually leading when it comes to the C-section rates, also leading when it comes to the NICU admission rates. It actually stands at 23.36%. And when it comes to the readmission rate, it's actually the second one after the City Medical Center. So you can actually check that it actually needs some improvements. For the City Medical Center, there's a lot of admission rates, but at least when it comes to the C-section rate, it was actually the least. You can actually check that the rate was actually standing at 42.93%. And when it came to the NICU admission rate, you can also check that it's actually here. You can also check that it had 19.98%. So it was actually one of the least too. The hospital which actually needs a lot of improvements is actually the University Hospital. It's actually the leading when it comes to the C-section rate, also the leading when it comes to the NICU admission rate, and also the second when it comes to the readmission rates. So that's all about the hospital comparison analysis. So remember, you can always break down this so that you can have something like a stacked column chart. So you can basically break down this in terms of age. Now we have actually said that for the readmission rate in the City Medical Center, it's actually equivalent to 13.04%. What if we would actually want to compare the readmission rates in this City Medical Center still, but based on the age groups? So what you have to do is come to this point here. Then you can just click inside like that, track this age which is actually in bins, or you can just select it like that. After selecting, now you can actually check on the breakdown. So in the City Medical Center Hospital, majority of the readmitted mothers are actually the ones aged 35 to 39, and that actually represents 18.92% of the whole mothers who are actually being readmitted in this hospital here, and that percentage is actually the largest. When it comes to this point again, for the University Hospital, you can actually check that it's the mothers aged 20 to 24. In this point here, you can actually check that it's actually the mothers aged 25 to 29. That's for the General Hospital. The readmission rate is actually 21.43%. On this part, you can actually check that it's the mothers aged between 20 to 24. The readmission rate is actually 10.53%. The hospital is actually Metro Health. And finally, in this point, you can actually check that majority of the mothers being readmitted are those aged 30 to 34, and that represents 12.24%. The hospital is actually Regional Hospital. So that's how you can actually convert it into a stacked column chart. And that's all about the hospital comparison analysis. So in this point, I want us to check on the delivery mode and the C-section rate analysis. So in that case, I would actually want us to check on to actually start on the C-section rate. So to check on the rate of cesarean delivery modes, what you have to do in this point is to count the number of mothers who have actually delivered through C-section. That is cesarean C-section. It's actually up there. Then you'll actually see it here. That's inside the deliveries table. I can just hit on the table view there. Then inside the deliveries table, you will actually see the delivery mode. So click on the deliveries table there, and you'll basically check on the delivery mode. We actually have two only. It's actually the cesarean and the vaginal. So I want us to see the C-section rate, which is actually the cesarean section rate. So in this point, what you are actually going to do is to count the number of mothers who have actually given birth through C-section. And to count the number of mothers who have actually given birth through C-section, we are going to count the number of rows where in this column we have cesarean, just like that. And after obtaining the number, then we actually divide by the total count of these rows inside this deliveries table. It's actually very simple. So we have to introduce what we call a DAX measure. So get into the deliveries table there, right click, then we basically hit on the new measure there and say we are obtaining the C-section rate. So backspace on the measure and the equivalent sign there, and I have C-section rate. So for the C-section rate, a space equal sign a space. So what you actually do in this point is to use the calculate like that, then open count rows. We are counting the number of rows inside the deliveries, inside the deliveries table like that, where the column for delivery mode is actually equivalent to cesarean, and that column for delivery mode is actually inside the deliveries table. So inside the deliveries table, we basically have delivery mode, and it has to be equivalent to cesarean. So cesarean, something like that. I think so. Then what you have to do is to close the quotation there. Then we also close the calculate function. Then we hit enter on the keyboard. After hitting enter on the keyboard, we will basically obtain the C-section rate there as a measure inside the deliveries table. So allow me to hit on the card. Then after hitting on the card, we'll actually drag that C-section into the card there, and you'll actually obtain the count to be equivalent to 563 mothers. So allow me to also hit on the measure there, so that we can actually remove that rate and call it count actually, so that the rate will actually go for the one with the percentage. So C-section count, you'll actually check on it on this point here below. So C-section count, C-section count. So I would also want us to check on the rate now, because we actually know that it's actually 563. So what is the rate? Because the percentage will actually be comparative, because if it's actually 60%, then it actually means that the other one is actually 40%. But in this point here, we have 563. So what you have to do in this point again is to obtain the total number of rows. Then after obtaining the total number of rows in the deliveries table, we have to say that total number of rows inside the deliveries table minus this one again. Now you can actually see that it's a lot of work. So what you have to do is to obtain the rate directly using the measure. So get yourself into the deliveries table there, right click, then after right clicking, hit on the new measure, and then this one now will actually be the C-section rate. So that's why you should actually be understanding this DAX. So C-section rate, like that, a space equal sign a space. Then we basically use the divide. So we are dividing, then we actually open. What are we actually dividing? We are dividing the C-section count by the total number of rows. So C, just like that, and you'll have the C-section count there. Then you just have to click on it like that. So we are actually dividing that C-section count by the total number of rows inside the deliveries table. So to obtain the total number of rows inside the deliveries table, what you have to do in this point is to use the count rows function. So count rows like that, then it's actually inside the deliveries table. So I'll actually click on the deliveries table like that and close it. So for the alternative result, we can actually say just a 0 there, and we close the divide function, then we actually hit enter on the keyboard. So this will now get us in terms of percentage, and it will actually be a very good picture when it comes to the delivery modes. So I'll actually click on the card like that. Then after hitting on the card, I'll drag the C-section rate into the card, and now you can actually check that for the C-section, it's basically equivalent to 0.51. So I can also click on the measure that, like that there, then get myself into the measure tools tab. In this point here for the formatting, we basically have what you call format. Then you hit on the general there, then you hit on the percentage, and you'll basically get the percentage to be 51.18%. So this is actually a very high percentage. So it actually means that the percentage of the mothers who actually give birth through the vaginal delivery mode is actually around 48.82. Yes, 48.82%. For the C-section rate, it's actually 51.18%, because the total must actually sum up to 1. So the C-section rate is basically equivalent to 51.18%. Now you can actually check that this percentage is actually too high, but we didn't actually expect to have such a percentage when it comes to the cesarean, because cesarean has to be a very small percentage, because it only takes the mothers who are actually at a risk. So it doesn't always take all the mothers. It always takes the mothers who are actually at a certain risk. So it actually means that in this point here, we might be having some mothers delivering on cesarean, which is actually the C-section, unnecessarily. So I would actually want us to check if we actually have some mothers who are actually undergoing this C-section unnecessarily. That is, they are undergoing through the C-section when they do not actually pose any risk. So I want us to check on the percentage there. So the conditions will actually be 2. That is, the delivery mode must actually be equivalent to cesarean, and when it comes to the high risk, it must be equivalent to a no, because you are basically identifying the mothers who are undergoing through cesarean when they pose no risk. That actually means that for the high risk column, it must be equivalent to no, and the delivery mode must actually be equivalent to cesarean. So I'm actually talking about the high risk, which is actually on this point here, that's the high risk flag. So the high risk flag, remember it was actually down here. Allow me to actually scroll. So the high risk flag must actually be equivalent to a no, and the delivery mode must actually equivalent to cesarean. So let's actually check how we can actually do that. So for that case, what we'll actually do, we can just come to this point here for the deliveries. Now you can actually check that we are dealing with two tables. The delivery mode is actually inside the deliveries table, and the high flag risk is actually basically inside the pregnancies table, but we can just focus on one of them. So this one here for the deliveries, then I just right click and hit on the new measure there. Then after hitting on the new measure, we'll actually call this one the low risk C-section count, just like that. The low risk C-section count, because you are basically picking where the high risk is equivalent to no. That actually means that it's a low risk. So low risk C-section count. So the delivery mode must actually be equivalent to cesarean, and the high risk flag must actually be equivalent to a no. Just like that. Equivalent sign there, then a space, then we use the calculate function. So calculate like that, then you actually open, then we use the count rows like that, then we also open. Then in this part here, we are basically giving the priority to the delivery mode, and the delivery mode, which is actually the cesarean. The cesarean is basically inside the deliveries table. So we'll have to pick on the deliveries table like that. Then we actually hit on it like that. Then after hitting on it like that, you can actually close. Then we are obtaining the total number of rows inside the deliveries table. This column here for the delivery mode must actually be equivalent to cesarean. So where the delivery mode, and the delivery mode is basically inside the deliveries table. So deliveries like that. Then in this point here, we'll have to pick on the delivery mode. So the delivery mode must actually be equivalent to cesarean. Must actually be equivalent to cesarean. So cesarean like that, and I actually close. Then after closing like that, a space, a comma, when you are actually using the calculate, you can filter them out by using the commas. You can separate the conditions by actually using the commas. So after a comma there, the next condition is that the high risk flag must actually be equivalent to a no. So the high risk flag is basically inside the pregnancies table. So what you have to do is to come again on this point here and type break like that, so that you can pick on the high risk flag. This one should actually be equivalent to a no, and you close the quotation there. That's actually okay. So we have two conditions here. The delivery mode must actually be equivalent to cesarean, and the high risk flag must actually be equivalent to no. And now remember, we are actually having the priority inside the deliveries table. So what you have to do is to hit enter on the keyboard, and after hitting enter on the keyboard, I expect us to have a measure inside the deliveries table there. So low risk C-section count. So in this part, allow me to also hit on a card. Then after hitting on a card, I'll actually drag the low risk C-section count into the card, and you can actually check that the low risk C-section count is equivalent to 396. The total number of C-sections in our data is actually equivalent to 563, and the low risk C-section count is basically equivalent to 396. That actually means that these 396 C-sections are actually unnecessary. So economically for the hospital, we actually have to do away with this number here. The C-section actually is very costly. It's actually very risky, which might in turn get us some unsatisfactory remarks later on. So we have to check on a measure or a way of lowering the C-section. That's the lowering the C-section count while maintaining the quality of the services. Now I would actually want us to check on the distribution of this C-section count generally. That's the 563 based on the age. What we actually have to do, we are actually doing the first one there, which is actually the C-section count generally. So I want us to use a column. So first of all, allow me to actually bring this the far right like that, and yeah, that's actually done. So we'll actually hit on a column like that. After hitting on a column, I'll actually drag the age into the x-axis. So scroll down there to where we basically have the age. So we can actually use the age bins so that we can stop creating another bin again. So drag it into the x-axis like that. Then we have to drag the C-section count. C-section count is actually up there inside the deliveries table. So C-section count is actually here. So you drag it into the y-axis. This is it. We can actually check on the distribution of the C-section. That's the distribution of this C-section count across the edges. So you can check that it's very clear that the majority of the mothers aged 30 to 34 undergo this C-section. For these mothers here who are actually aged 35 to 39, and this one's also aged 40 to 44, you can actually check that the columns are actually high. So we can actually say that mothers aged 30 and above have a high risk of undergoing cesarean delivery mode. And when it also comes to this point here, we can also analyze based on the race. We have the bar chart. It can actually work good here. So drag it like that. I want us to analyze based on the race or ethnicity. So I'll actually drag the race or ethnicity, which is actually this one here. Drag it into the y-axis like that. Then into the x-axis, I want us to actually get the C-section count. So the C-section count into the x-axis. Done. And clearly you can actually check that the Hispanic mothers actually have a high risk of undergoing the cesarean delivery mode because their count is actually 128. And Asian mothers actually have a low risk when it comes to undergoing a cesarean delivery mode. They are actually 94. So the ones who actually pose a higher risk of undergoing the cesarean is actually the Hispanic mothers, 128 of them. So we have checked based on the age, based on the race. We can also check based on the insurance type. So for the insurance type, allow me to actually use a pie chart. So I'll actually click on a pie chart like that. Then this is it. Then we have to drag in the insurance types into the legend. So the insurance types into the legend. The insurance types is inside the mother's table there. So insurance type into the legend like that. Then in this point here for the values, we have to drag the C-section count. The C-section count is actually inside the deliveries table. So C-section count into the values. Just like that, and it's actually done. So you can actually check that it actually needs some space so that it can become visible. So we have to squeeze this like that. And on this part too, we can somehow squeeze this again. So just squeeze like that. Then this one can now get the space. So expand to the right like that. This point too, to the left. And that's actually better. So I can now hit on the focus mode. So in this point here, you can actually check that we have the insurance types. We have the uninsured, the Medicaid insurance, and the private insurance, the unknown. We can actually check that there were some insurances which were basically unknown. Then we also have the Medicare. So the uninsured mothers actually have a high risk of undergoing the C-section or the cesarean delivery mode. So what we'll actually give as a decision later on is to actually have these mothers insured, because if they are uninsured and they are actually getting a risk, then they can actually be insured like these mothers here. You can actually check that we have Medicare doing well. So we just have 15.99%, which is around 16%. Not bad. This one's again unknown insurance. These ones were actually insured, but we do not know the insurance types there. On this point here, we add the private insurance, and also in this point here, we add the Medicaid. So 25.22% is actually a higher risk. That's all when it comes to the delivery mode and the C-section rate analysis. So in this point, we'll be checking on the high risk pregnancies and complication analysis. So if you click on the pregnancies, you can basically check that we have a column for complications. This one here. So we have the preterm labor, we have the preeclampsia, we have preeclampsia again, we have gestational diabetes, we have none that is delivered and got no complications. So basically in this point here, we can use this filter button there so that you can check on the number there, and you can check that we have the first one to be gestational diabetes. Yes, then the second one is actually hypertension. Then we have none, then we have preeclampsia, then finally we have the preterm labor. So we can actually check on the spread of this, that is the rate of these complications. So let's identify the rate for gestational diabetes, the rate for hypertension, rate for preeclampsia, then preterm labor. Those ones are actually the 4 common complications that we do have. This one, none, actually means there's no complication. This unknown actually means that we do not, there is a complication, but not actually known, not established by then. So the most common ones are actually gestational diabetes, hypertension, preeclampsia, and preterm labor. So I want us to check on the rates. So which one is actually the most common and which one is actually the least common, and what is the distribution of these complications across the different demographic groups. So that's what we actually want to analyze in this point. So we actually start with the gestational diabetes. So let me actually get into the report view there. So for gestational diabetes, remember we are basically inside the pregnancies table. So for gestational diabetes, what we actually have to do first is to obtain the count for the complications equivalent to gestational diabetes. Then we have to finally say, given that we have the count, we can obtain the percentage by saying count divided by the total complications. That is the count of gestational diabetes divided by the total complications. Then we can convert that 0 point something into percentage so that we can now obtain the percentage. That also applies to hypertension, applies to preterm labor, then also applies to preeclampsia. Then we can now see the one which is actually the most common, and then we can also check on the distribution of these complications across the different demographic groups, and basically how these complications can actually be reduced. So first of all, we are starting with the gestational diabetes. So get yourself into the pregnancies table there, right click. After right clicking, hit on new term. Then after hitting on new term, we can basically say gestational diabetes count, GDC. So gestational diabetes count, just like that, space equivalent space. So in this point, we'll actually use the calculate. So calculate, then we also use count rows, and this is basically inside the pregnancies table. So hit on the pregnancies like that. So we are counting the number of rows inside the pregnancies table where the column equivalent to complications has gestational diabetes to be the complication. So this complications is basically inside pregnancies table. So pregnancies table like that, then we have to pick on complications there. So this must be equivalent to gestational diabetes, just like that, and you close the quotation and you also close the calculate function. So we are obtaining the number of rows in the pregnancies table where the column, which is actually complications column, is equivalent to gestational diabetes. So basically we are obtaining the count of gestational diabetes. Hit enter on the keyboard, and let's actually wait as our measure actually loads. Now this is it, gestational diabetes count. So what we can actually do in this point is to hit on the card like that. Then after hitting on the card, we can drag this gestational diabetes count into the field, just like that. That is into the field, and we have gestational diabetes count to be equivalent to 184. So we have a total of 184 mothers who had the complication being gestational diabetes. Now I want us to check on the distribution of this disease across the different demographics, like for example the age. So for the age, what you are going to do in that point is to hit on a column chart like that. Then after hitting on a column chart, we will actually have to drag the age bands into the x-axis like that. Then after dragging the age bands into the x-axis, we have to drag the measure into the y-axis, which is basically the gestational diabetes count. So inside this point here, we have gestational diabetes count inside the y-axis, just like that. And allow me to actually expand it. Yes. Then we can have it up there. Yes. So in this case, allow me to also take it up there like that. And I think that's okay. Now, in this point, we can actually conclude that mothers who are actually aged 40 to 44 are the ones leading when it comes to gestational diabetes with a count of 41. So 41 mothers there. So followed by this one here. So mothers again who are aged 30 to 34 are actually the second leading when it actually comes to gestational diabetes complications. They are actually 38 of them. Then followed by this one here, which is actually 35 to 39. So mothers aged 35 to 39 are actually the third when it comes to gestational diabetes count, and they are basically equivalent to 35. In this point here, what we can actually try to see is that it looks like there's a pattern. So it's basically rising up there. So we can actually say that gestational diabetes actually goes with age in our case here, because a majority of them are actually the aged 40 to 44, and the list is actually this age here of 15 to 19. So 15 to 19, they are basically 14 only. So then it actually rises like that, rises up to the highest one, which is actually age group of 40 to 44, a count of 41. So we can basically say that this count actually increases with age. The count of 184 actually spreads by increasing with the age. That's it. we can also check on, apart from the age, we can as well check on the income. So let's also check on the income group. So for the income group, we have it on this part here. Basically for that, we can have a pie chart. Yes. So click outside there, then hit on a pie chart. Then after hitting on a pie chart, allow me to drag it at the center here. After taking it to be at the center, increase it like that, then drag it downwards there. So you have to drag the income group into the legend. Very simple. Then we also have to drag in, that is the gestational diabetes count. So scroll downwards to where we have the gestational diabetes count. So drag it into the values, just like that, and it's actually done. So basically we can come up with the conclusion that, because we have the percentages there, so we can actually come up with the conclusion that mothers in the low income group are actually leading when it comes to the gestational diabetes, because they have a percentage of 38.04, which is actually equivalent to 70. So when it comes to gestational diabetes, majority of the mothers in that group are the ones coming from the low income group, and they are basically equivalent to 70, and that 70 basically represents 38.04%. Allow me to hit on the focus mode. It will be better for visibility. Now in this part, we can as well conclude that mothers from the high income group are the ones who are actually having the low count when it comes to the gestational diabetes, because they are basically 55, and that represents 29.89%. And we can also check on the distribution based on, let's say, the race. Then after the race, we can also check on the distribution based on the parities. After the race, we can also check on the distribution based on the pre-existing conditions. So the next item that we can basically use in this point, let's say the bar chart. Yes, the bar chart, that one can actually work well. So we have to drag it to this part here, that is to the left. Then I increase again, that is dragging it to the right. So in this point here, what we have to drag to the x-axis is basically the gestational diabetes count. So gestational diabetes count into the x-axis like that, and into the y-axis we will now be having the race, which is actually the ethnicity. So drag the race into the y-axis there. So that's all. This is now a bar chart. Now you can actually check that we have others taking the longer bar, followed by Hispanic and the white, followed by Asians and the blacks. So when it comes to others here, this others is actually a combination of other races. So let's say, for example, we have two other races there. So we can't actually say that this others is actually the largest when we have Hispanic standing alone at 43, and also the white standing alone at 43 again. Majority of the mothers suffering from that complication will be the Hispanic and the whites. And the blacks will actually be least affected by the complication, because their count is actually at 22. So the blacks are the least affected by this complication. That's the gestational diabetes. And the Hispanic and the white mothers are actually highly affected by gestational diabetes, because their count actually stands at 43, and the count for the blacks actually stand at 22. And finally, we can also check on the distribution of gestational diabetes count based on the educational level. Yes. So what you can do in that case, because we have already used the column chart, we have also used the bar chart, and we have used the pie chart. Then in this point, I think it will also be better if we actually use the educational level. Then inside the educational level, we will actually be having the issue of parity inside that educational level. So we have two items here. So it will be a stacked column chart. So I'll actually pick on the normal column chart there, which is actually the stacked column chart. And this one will always get you a column chart until you actually add something else into the legend, so that it can now become stacked. So that's it. Now into the x-axis, we will basically be having the educational level. So educational level into the x-axis like that. Then into the y-axis, we will basically drag the gestational diabetes count into the y-axis like that. And now you can actually check that educational level directly affects the gestational diabetes. As the education level actually goes higher, there's actually a decrease in the count for gestational diabetes. That is, for mothers who actually have their education level to be high school, they are actually a whopping 59. Then it actually reduces to 47, or when the level actually changes to bachelor's. When the level is actually college, it's actually 41. And when the level is actually masters, it's actually that 7. So basically, you can say that gestational diabetes count has been affected by the educational level. Now, I want us to break down this column based on something else, which is basically the parity. So we have to drag the parity into the legend. So scroll down here and we'll have what you call the legend. So drag down the parity into the legend. And this is it. So in this part here, we can actually check that we have this one here, which is actually count of 12 when it comes to gestational diabetes. This one here is actually a count of 11. This one also is a count of 11. This one is a count of 16. And this one is actually a count of 9. So when it comes to the mothers who have their education level to be high school, so in this education level here for high school, majority of the mothers with the gestational diabetes complication are the ones with the parity of 1, and the count actually stands at 16. When it comes to the bachelor's education level, majority of the mothers who actually suffer from that complication have a parity of 4. When it comes to the college education level, majority of the mothers suffering from this complication are the ones who have a parity of 1, and the count is actually 13. They are 13, and they have a parity of 1. When it comes to the master's education level, majority of the mothers actually suffering from these complications are the ones having a parity of 0, and their gestational diabetes count is actually equivalent to 9. So this one can actually help you when it comes to going to the exact group, which are actually the highest affected. So this breakdown will always help you when it comes to outreach programs and many other things, because you won't have to spread your money in reaching all these mothers. No, you actually have to reach the most affected group. So in this education levels, which is actually the high school one, the most affected group is actually the ones for parity 1. And this one here, the most affected group is actually parity 1 again. This one is also parity 1. And in this point here, we can actually check that we have parity 0 being affected. So generally, we can conclude that when it comes to gestational diabetes, majority of the mothers being affected are the ones who have parity 1. And that's it. Because this one is actually parity 1. This one is also parity 1. And this one is also parity 1. And mothers who have educational level of high school are also the most affected, with the column actually being too long. Just like that. And that's it about the breakdown of gestational diabetes when it comes to the age group, when it comes to the income group, when it comes to the race, and also when it comes to the parity and the educational level. I want us to also check on the breakdown of, that's the count of hypertension. Then we won't actually remove this. Yes, I won't actually remove these visuals here. We'll just be replacing what you have here, which is actually gestational diabetes with hypertension. Then we also replace it with preeclampsia. Then we basically replace it with preterm labor. So I want us to obtain the count for hypertension. When it comes to the count for hypertension, what we'll actually do in this point here, because we are basically inside the pregnancies table, I'll actually right click there. Then in this point, I'll hit on the new measure. Then I'll actually remove the new measure there. Then I say hypertension count. Hypertension count space equivalent sign a space. Then in this point, we'll actually use the calculate function like that. Then count rows. Then open. Then we are basically inside the pregnancies table. So pregnancies table like that. Then in this pregnancies table, we are actually counting the rows where the complication is actually equivalent to hypertension, and that complication is basically inside the pregnancies table. So pregnancies, then hit on complications there, space equivalent sign, a space, opening quotation there, hypertension, just like that. And closing quotation, then I just have to close the calculate function, just like that. So we are counting the total number of rows inside the pregnancies table where the complications column, and that complications column is basically inside the pregnancies table. So where the complications column is basically equivalent to hypertension, just like that. And I just have to hit enter on the keyboard. And after hitting enter on the keyboard, we'll have the hypertension count here. Now you can actually take that we have a new measure inserted inside the pregnancies table there. So I can actually click on the gestational diabetes count there to actually activate it. So we have it in this point to be inside the field. So I'll actually remove it there. Then I just have to drag the hypertension count into the field. So replace it there, hypertension count into the field. And in this point here for gestational diabetes count by age, you just have to click on it like that. So drag it down here, remove gestational diabetes count there, drag hypertension count into the y-axis. Very simple. And that's actually done. When it comes to this point again, I'll actually click on the visual there. Then for the y-axis, we have gestational diabetes count, remove, drag the hypertension count into the y-axis. On this part, for the income group, I'll actually click on it like that. Then inside the values, remove the gestational diabetes count, drag hypertension count into the values. And finally, on this bar chart here, click on it there, remove the gestational diabetes count there, drag the hypertension count into the x-axis. So that's done. So let's now come up with the insights. Now you can actually check that it's actually very simple. So in this part, we can basically conclude that when it comes to the mothers with the hypertension complications, majority of them are the ones who actually come from the age group of 30 to 34 because they are basically equivalent to 51. And the least number of them actually come from the age bracket of 15 to 19 because they are basically equivalent to 12. That's actually very simple. And when it comes to the mothers with hypertension, yes, majority of them are the ones who actually hold the bachelor's degree, and the least of them are the ones who actually hold bachelor's education level, and the least of them are the ones who actually have the college education. Now, this has also been broken down based on the parity. So when it comes to the mothers with hypertension, I want us to check on the ones who have the bachelor's degree, and inside the bachelor's degree, we will also be checking on the parity. So inside this point here, we can actually check that majority of the mothers in this case are the ones who have a parity of 1. Yes. So when it comes to mothers with hypertension, majority of them are the ones who actually hold bachelor's education level. The majority of the mothers holding the bachelor's education level and with hypertension actually have a parity of 1. When it comes to this one here, which is actually the master's education level, you can actually check that parity 0 is actually a count of 13, and this parity 4 is actually a count of 15. So when it comes to the mothers with hypertension and the education level being masters, then majority of them are the ones with a parity of 4. When it comes to mothers with hypertension and with the education level being high school, majority of them are actually with the parity of 3. And on this part here, when it comes to mothers with hypertension and with the education level being college, majority of them are actually with the parity of 0, and their count is actually 12. So that's how you can actually do the analysis there. And we can also do the analysis in this point here, that is for the income group and also for the race here. So for the income, we can actually check that when it comes to mothers with hypertension, majority of them are the ones with high income because they are actually 68, and that actually represents that 6.96%. And the least are actually the ones with the medium income because they are basically 51, and that basically represents 27.72%. When it comes to race or ethnicity, we can basically conclude that majority of the mothers with hypertension are basically the blacks, and that one is actually a signal that the blacks are highly affected by hypertension. So I want us to have a count of preeclampsia so that we can also come up with the insights. So right click there, then have a new measure, then we'll actually call this one the preeclampsia count. So preeclampsia count, just like that, space, equivalent sign, a space. So in this point, we'll say calculate, then we introduce the count rows like that. Then we have the pregnancies table there. Then we have to close the count rows function. So we are counting the number of rows inside the pregnancies table where the complication is actually equivalent to preeclampsia, and that complication is actually inside the pregnancies table. So you just have to type preg like that, then you have to hit on complications. Then it has to be equivalent to preeclampsia. So preeclampsia like that, then you close the quotations, then you actually close the calculate function too. So the moment I actually hit enter there, we'll actually be having a measure inserted in the pregnancies table, and it will actually be the preeclampsia count. Scroll down there so that you can actually check preeclampsia count. So what you are going to do is to click on the card there, then scroll up there. We'll basically be having the hypertension count. Remove that hypertension count, drag the preeclampsia count into the field. Now we have preeclampsia count to be equivalent to 210. It's actually the highest at the moment because I think the first one was 184 and then the second one was also 184. This one is actually 210. Don't worry about that. We'll actually check on the rates later on, or we'll actually check on the total counts later on. Then we'll actually come up with the one which is actually the most common. So in this point here, I'll actually click on the first measure there, scroll down here, then I'll actually remove the hypertension count, drag in the preeclampsia count, just like that. On this point too, for education level and parity, I'll remove the hypertension count, then I'll just drag in the preeclampsia count into the y-axis. On this point too, for the pie chart, I'll click on it like that, then remove the hypertension count, then I'll drag in the preeclampsia count into the values. And finally, for this part here, which is actually the hypertension count by race and ethnicity, I'll click on it like that, remove the hypertension count, then I drag in the preeclampsia count into the x-axis, just like that. Now it's our time to actually come up with the insights from this data here. So basically you can check that this one, it's like it also goes with the age. Yes. So when it comes to preeclampsia count, for the age bracket of 15 to 19, we have a count of 16. And when it comes to the age bracket of 40 to 44, we have a count of 44. And you can actually see that it actually dominates on these age brackets too. That is from 20. You can actually check that there's a slight increase. That is from count of that 5. Then it slightly increases to that 6, increases again to 42, then decreases, then also increases. So we can actually say that preeclampsia count, we can actually say that preeclampsia actually affects the aged mothers. That is from late 20s as it actually continues, or mostly it affects mothers in their mid 20s as it actually heads to 40s, just like that, because that's where we have the majority of the mothers settled in. For this count here of 15 to 19, it's not actually that common. So that's the conclusion. Just the same way we actually concluded with the first one, which was actually the gestational diabetes. So it actually increases with increase in age, just like that. So let's also check on the education level and the parity. So for the education level, we can actually check that this 210, that's the distribution. So majority of the mothers who actually have preeclampsia are the ones with the bachelor's degrees. And the list of them are actually the ones with the college education level. So from bachelor's to master's to high school, then to college. But inside the bachelor's education level, majority of the mothers, again, the biggest count actually comes from the mothers with a parity of 2, because they are basically 16. And when it comes to the mothers with the master's education level, the biggest count actually comes with those with the parity of 2 again. So this one was actually a parity of 2. This one is also a parity of 2. Let's also check in this point here. In this part here, when it comes to preeclampsia, for the mothers with high school educational level, that is those mothers with the preeclampsia, majority of them are actually the ones with a parity of 1, because this one is basically a parity of 0. This one is a parity of 1. So majority are the ones with a parity of 1. And in this part too, which is actually mothers with the college education level, majority of the mothers with the preeclampsia are actually the ones with a parity of 2. So they are basically equivalent to 11. So we add a parity of 2 in this point here. We also have a parity of 2 here. And we also have a parity of 2 here. So we can actually conclude that preeclampsia highly affects mothers with a parity of 2. Now I want us to come up with a conclusion when it comes to the income group here. We can actually check that majority of the mothers who are actually affected by preeclampsia are the ones earning the low income, the ones from the low income group, because they are basically equivalent to 81 mothers, and that represents that 8.57%. So that 8.57%. So preeclampsia highly affects the mothers with the low incomes. And when it comes to the race, we can clearly see that preeclampsia highly affects the blacks, because we have a count of 59, a whooping 59. And it's actually one very long bar. So preeclampsia highly affects the blacks. We have a count of 59, and it least affects the Hispanic, because they have a count of that 4. This is actually a mixture. We have others here. So others too, we can actually include that they are least affected, inclusive of the Hispanic. So the Hispanic and the others are actually the least affected when it comes to preeclampsia. But when it comes to the blacks, they are actually the highly affected. So that's all when it comes to preeclampsia. I want us to also check on the preterm labors. So for the preterm labors, we'll actually come to this point again for the pregnancies table. So inside the pregnancies table there, I'll actually right click, then I hit on the new measure. Then this measure will actually be called the preterm labor. So I'll actually backspace, then I call it the preterm labor, just like that. Space, equivalent sign, and space. So we are using the calculate and the count rows. So calculate, then count rows like that. Then we actually open. We are counting the rows inside the pregnancies table. Yes, where the column is equivalent to preterm labor. So that column is basically inside the pregnancies table again. So where the column is actually equivalent to preterm labor. So opening quotation. So preterm like that. Then underscore labor, then closing quotation. Then you also have to close the calculate function, then hit enter on the keyboard, and you will have a measure inserted there. So scroll down there so that you can actually check on the preterm labor. So we have the preterm labor. We can actually call it the preterm labor count. So there's no problem. So preterm labor, then we have to include count, preterm labor count. So hit enter on the keyboard, and that's all. Now I want us to do some analysis here. So first of all, we have to click on the preeclampsia count there so that we can have the visual here. So remove it. Then you have to drag in the preterm labor count into the field. Then on this part to click on it once like that. Scroll down to where we have the y-axis. Remove that preeclampsia count. Then drag in the preterm labor count like that. On this part too, you have to click on the education level and parity. Remove the preeclampsia count, then you just have to drag in the preterm labor count into the y-axis. On this part too, for the race or ethnicity, we have to remove the preeclampsia count, drag in the preterm labor count, and finally for the pie chart, we have to click on it like that, remove the preeclampsia count, have the preterm labor count. So basically, we can now come up with the conclusions, and we'll actually say that the total number of mothers affected by the preterm labor is actually equivalent to 204. So I want us to check on the distribution of these 204 based on the age group, based on the education level and the parity, the race or the ethnicity, the income group, and also come up with the conclusions. The highest column here is actually for the age group of 30-34. The number of mothers with the preterm labor is actually equivalent to 51. That's actually the highest one here. So age group is actually 30-34. And followed by this one too, you can actually check that the age group is actually 35, so 35 to 39. They are basically equivalent to 44. So it's high time that we actually conclude that preterm labor is actually highly common with the mothers in their 30s, because this one here is actually 30 to 34, and this one is also 35 to 39. So preterm labor is highly common with mothers in their 30s. That's the conclusion that we can actually come up with in this point here. We can also come to this point here for the education level and the parity. So we can as well conclude that majority of the mothers who have preterm labor have the master's education level, and the ones who are actually least affected have the college education level. But when it comes to the mothers with the master's education level, the ones who actually lead are the ones with a parity of 2. And when it comes to the mothers with the high school education level, the ones who actually lead when it comes to the preterm labor are the ones with a parity of 1. When it comes to the mothers with the bachelor's education level, the ones who actually lead when it comes to the preterm labor are the ones with a parity of 0. In this point here, when it comes to the mothers with the college education level, the ones who actually lead when it comes to the preterm labor are the ones with a parity of 2. So that's it. That's how you can actually check on the parities and the education level. So you can now focus on, let's say for example, you wanted to focus on the education level. Now you can actually focus on masters, but inside the masters, you can actually focus on the mothers with a parity of 2, because that group is the one which is actually leading when it comes to the preterm labor count. Now, let's also check when it comes to the income group. So majority of the mothers with preterm labor actually come from the low income group. So they are actually 72, and this one represents that 5.29%. And the least are actually the ones who actually come from the medium income group. They are actually 65, and that represents that 1.86%. And the ones who are actually from the high income group are actually 67, and that represents that 2.84%. So basically we can conclude that majority of the mothers with preterm labor are the ones with the low incomes. In this part too, it's high time we actually come up with the insights and a conclusion. So majority of the mothers here who are actually Hispanic are the ones mostly affected by the preterm labor. They are basically equivalent to 46. That is, the Hispanic are equivalent to 46. So the Hispanic mothers are highly affected by the preterm labor. And the black mothers are the least affected by the preterm labor because they are basically equivalent to 32. So that's all when it comes to the preterm labor. Now I want us to check on which one is the most common between the preterm labor, the gestational diabetes, the hypertension, and also the preeclampsia. So let's actually check on that. So I'll actually remove this. So I'll click on this like that, then hit on these three dots, then hit on remove. Come to this point again, click on it like that, then hit on the three dots there, hit on remove. Come to this point again, click on it like that, come to these three dots again, then hit on remove. Then finally in this point too, you have to hit on the three dots, then you hit on remove. So we have the preterm labor there. So I want us to drag in for preeclampsia. So we will have a different card. So we can just click on this card like that. Then we hit on, because they are basically four, we have gestational diabetes count, hypertension, then we have preeclampsia, then we have the preterm labor. So this one is actually for the preterm labor. We can have four of them. So Ctrl C, now hit Ctrl V, hit Ctrl V again, hit Ctrl V again. So we have four of them. So drag the first one to the right there. This one here, which is actually the second one, drag it again to this part here. Then this one, you can have it on this point. So we have for preterm labor. This one is also showing us preterm labor, so we have to change it. So cancel that preterm labor count and drag in a different item, which is actually preeclampsia count. So preeclampsia count is actually here. So drag it into the field like that. And that's actually done. It's actually 210. For the preterm labor again there, we have to remove it and have hypertension count inside the field. And finally, for this point here, which is actually the gestational diabetes count, we have to click on it like that, remove it from the field. Then we have to drag in the gestational diabetes count, which is actually up there, gestational diabetes count, GDC, into the field there, and we have 184. So we can basically say that the most common complication is actually preeclampsia, and the least common complication are actually hypertension and gestational diabetes. That's all about the high risk pregnancy and the complication analysis. Let's check on the next item. At this point, we'll actually check on the prenatal care utilization analysis. So when it comes to the prenatal care, we'll basically be focusing on the prenatal visits count. And this, you can actually check that we have the prenatal visits count inside the pregnancies table. So we can basically get into the table view there, then hit on the pregnancies table. So it's actually here, click on it like that, so that you can check on the prenatal visits count. This is actually the number of visits for these mothers before they actually give birth. So that's actually prenatal visits count. So for this mother here, M00028, the number of prenatal visits count is actually equivalent to 7. We have even one going for 13 counts. We even have one going for 14 visits. That is M006 or 6. So we would actually want to check on those mothers who are actually having less than 8 visits, because less than 8 will actually be inadequate prenatal care. So for the inadequate prenatal care, we'll be counting those mothers who have actually attended for less than 8 prenatal visits. So like in this point here, we have this mother. She actually has 7. This mother again, this is number 2. This is number 3. This is number 4. And scroll down there to where we also have less than 8. You can check, we have 7 there, we have 6, we have 5. All the mothers who actually have prenatal visits count to be less than 8 will actually be grouped as having inadequate prenatal care. So let's now obtain the count of those mothers who actually have inadequate prenatal care. So for the inadequate prenatal care, we basically have to use the calculate function, the count rows function, and that's it. So we actually come to this point here for the pregnancies table. Then we actually right click. So for the number of mothers receiving inadequate prenatal care, we have to come to this point here for the pregnancies table, because that's basically where we have the prenatal visits count. So go to that point there, right click. Then after right clicking, we have the new measure. Then we'll actually say number of mothers receiving inadequate prenatal care. So number of mothers, then we actually say inadequate prenatal care, just like that, space equivalent sign asterisk. So the number of mothers receiving inadequate prenatal care is actually equivalent to, then we actually use the calculate function. So calculate, then we have to count the rows, and we are basically inside the pregnancies table. So pregnancies like that, just type preg, then you'll have pregnancies, just like that, you close. So we are basically counting the number of rows inside the pregnancies table, where is actually brought in by the use of calculate. So where the prenatal visits count, which is actually inside the pregnancies table again. So preg like that, where the prenatal visits count is actually down there. Yes, prenatal visits count, which is basically inside the pregnancies table, is less than 8, just like that. So we are counting the rows inside the pregnancies table, where the column, that is the prenatal visits count column, yes, is actually less than 8, just like that. And you have to close the calculate function. So the moment I actually hit enter on the keyboard, we'll actually be having that measure there. That's the number of mothers receiving the inadequate prenatal care. So allow me to actually use a card in my case. I'll actually click on a card, then I'll actually drag this number of mothers receiving the inadequate prenatal care into the card there. Then you can actually check that the number of mothers receiving the inadequate prenatal care is equivalent to 357. So it will also be very important if you actually break down this in terms of percentage. So to obtain the percentage, we actually have to divide this number here, 357, by the total number of mothers. So this one is actually the number of mothers receiving the inadequate prenatal care. Then we divide by the total number of mothers. Then we'll actually obtain the percentage. So let's actually check how we can actually do that using a measure. So we have to come to this point again into the pregnancies table there. Then we actually right click. Then we have a new measure there. Then what we actually do next is to backspace there, so that we can write inadequate prenatal care in terms of percentage, space equivalent sign a space. So it will be equivalent to, in this point now, we are basically using the divide. So divide like that, then open the bracket there, then square bracket, so that you can actually have the measure that we actually created there. And you can actually check that it's actually here, the number of mothers receiving the inadequate prenatal care. That's it. Then a comma, a space. So we are dividing the number of mothers receiving the inadequate prenatal care by the total number of mothers. And to obtain the total number of mothers in this point here, we have to obtain the total number of pregnancies. So for the total number of pregnancies, we actually have to say count rows, then inside the pregnancies table, that is the total number of pregnancies. We are basically going to count the number of rows that we have inside the pregnancies table. It's actually very simple. So count rows like that, then open, then just type reg like that, and you actually check on the pregnancies, then close the count rows function. So this one will actually count the total number of rows inside the pregnancies table. In short, it will count the total number of mothers inside the pregnancies table. In this point here, it was the total number of mothers who are actually receiving the inadequate prenatal care. So it will be the number of mothers receiving the inadequate prenatal care divided by the total number of mothers. Then for the alternate result, we can have a comma, then a 0, just like that, and we close the divide function. So the moment I actually hit enter, we'll actually have inadequate prenatal care in terms of percentage. So allow me to actually click on a card. After clicking on a card, we can drag it in this point here. Yes. So now drag the inadequate prenatal care in terms of percentage into the card. So into the field like that, and that's actually okay. So we have 0.32, which is basically equivalent to that 2%. So I can click on the measure again there, measure tools tab. Then in this point here, we have formatting, format. Then I hit on percentage. Then I can actually increase the decimal places. So I can increase it to 3 decimal places. It will be that 2.455. I can also reduce it to 2 decimal places, which will actually be that 2.45%. So this is basically the number of mothers receiving the inadequate prenatal care in terms of percentage. But in terms of the count, we have them to be equivalent to 357 mothers. Now, I would actually want us to break down this percentage here in terms of age and in terms of education level, because those ones will actually be the most common indicators. So I want us to actually see if the education level is actually affecting this inadequate prenatal care, or if the age group is actually affecting this inadequate prenatal care, or if the income level is also affecting the inadequate prenatal care percentage. So we can actually hit on something like a stacked column chart like that, then drag it to this point here. I can drag it a bit to the left, which is actually okay. Then now drag it to the right. So on this part here, for the x-axis, we'll actually drag the age group into the x-axis, or we can actually start with the income group. So allow me to have the income group. Income group is actually up there inside the mothers. So drag the income group into the x-axis like that. Then after dragging the income group into the x-axis, make sure you also drag the inadequate prenatal care, that's in terms of percentage, into the y-axis. Just like that, and it's actually done. So that's enough. Allow me to actually drag it down so that we can actually check if there is some difference in the heights of these columns here. So basically, you can check that for the inadequate prenatal care in terms of percentage, majority of the mothers who are actually receiving the inadequate prenatal care are actually from the low income group. You can actually check that the income group is actually low, and the inadequate prenatal care in terms of percentage is actually 33.51%, which is actually very high. You can actually check. And on this point too, you can actually check that the mothers who are actually inside the medium income group are actually that 2.19% in terms of the inadequate prenatal care. And the mothers who are actually receiving the high income are actually having the inadequate prenatal care of that 1.59%. So we can basically conclude that income actually affects or has an impact on the prenatal care. It's actually an indication that mothers who are actually having the low income, majority of them are actually receiving the inadequate prenatal care. So that's all about the income. And I would also want us to check on the impact of the education level. So for the education level, we can actually have a bar chart. There's nothing wrong with that. So I can actually click on a bar chart like that, then drag it to the right. Then that's okay. That's actually enough. So in this point, because you are basically dealing with the education level, on the y-axis, we'll actually be having the education level. So education level on the y-axis, like that. Then we drag the percentage, that's the inadequate prenatal care percentage, into the x-axis. So that's actually enough. Basically, you can check that all these bars are almost of the same size, but you just have to hover your mouse so that you can actually check the difference. And in this case here, for the mothers whose education level is actually high school, they actually have the highest prenatal care percentage of that 4.01. And the mothers with the bachelor's education level have the inadequate prenatal care percent of 28.10%. So basically, we can come with a conclusion that the education level has an impact on the prenatal care, because it's now evident that mothers whose education level is actually high school are the ones leading when it comes to inadequate prenatal care, while the mothers with the bachelor's degree are actually the least when it comes to the inadequate prenatal care. And this actually gives you an indication that education actually has an impact on the prenatal care. So we have actually checked that income has an impact when it comes to the prenatal care, and also education has an impact too when it comes to the prenatal care. So if at all we are supposed to do some outreach program about the prenatal care, then we are basically supposed to focus on the mothers whose education level is actually high school. And on this point too, in this case, we have in this point here for the education level and for the income group, I would also want us to break down these two based on the income. What we'll actually do, I'll actually click on the one for the income. So we have the x-axis to be the income group. The y-axis is actually the inadequate prenatal care in terms of percentage. Then you can actually check that we have the legend. So as you can actually check, this one is a column chart. But if we add something else to the legend, it will be a stacked column chart. So it's actually a column chart here, but if we actually break it down, it will be a stacked column chart. So what you have to do is to drag the age into the legend. So look for the age, and basically you can check that we have the age bins there. And we also have the age bins on this point here, but just allow me to drag it as it is into the legend so that you can actually do the corrections on our own. You can actually check that there are so many. So allow me to actually break it down by having it in terms of 15 to 20, 20 to 25, 25 to 30, 30 to 35, 35 to 39, 35 to 40, 40 to 44. So click on the down arrow there, then we have what you call the new group. So inside the new group, age is actually bins, group type is bins, bin type is actually size of the bins. The bin size is actually 5, so that it can move from 15 all the way to 20, 20 to 25, 25 to 30. So basically that's what we actually call the bin size. So I'll actually hit on OK in this part here, and you'll actually check that there will be an impact there. So we have this one is actually the age group, that's 15 all the way to 19. Why am I actually saying 15 to 19? Because the next one will actually be from 20 all the way to 24, and the next one will be 25 all the way to 29. Then the next one will be 30 all the way to 34. The age group in this point is actually 15 all the way to 19. On this point here, the age group is actually 20 all the way to 24. The age group in this point here is actually 25 all the way to 29. The age group here is actually 30 to 34, and here it will be 35 to 39, and finally up there it will be 40 to 44. So I want us to actually see if we actually have an impact based on the age group. Mothers from 35 to 39 are actually leading when it comes to the inadequate prenatal care, that is in the low income group, with 41.67%. In the low income group, the age group which is actually leading when it comes to the inadequate prenatal care, and the percentage is actually 41.67%. So that one will actually help us to actually focus on this age group when it comes to coming up with an outreach program to sensitize the mothers about the prenatal cares. We actually know that this column here for the low income group is actually leading in the inadequate prenatal care. But which age group? The age group to be given attention is actually 35 to 39, because it has the inadequate percentage of because it actually has the inadequate prenatal care percentage of 41.67. So that's it. Now, when it also comes to the medium income group, you can actually check that it's doing fairly good, but obviously there's a group here which actually has to be addressed. Yes, so the group which actually has to be addressed because it has the highest inadequate prenatal care is actually this one here. That's the group of bin 3, which is actually 30 to 34. So age group of 30 to 34 has the inadequate prenatal care, that's 42.50%, and it's actually the highest when it comes to this group here. So in the medium income group, the age group to be given attention when it comes to the inadequate prenatal care are actually 30 to 34. The age group are actually the age group of 30 to 34 because it has the highest prenatal care percentage of 42.50. And finally, on this point here, you can check that the majority of the mothers receiving the inadequate prenatal care are the ones in the age group of 15 to 19. So 15 to 19, the inadequate prenatal care percentage is actually that 5.29%. That is majority of the mothers who are actually having less than 8 prenatal visits count. So it actually represents that 5.29%, that is in the high income group. And we can basically conclude that when it comes to sensitizing the mothers receiving the high income, we have to focus on these mothers here whose age group is actually 15 to 19, because they are basically the leading in the high income group with that 5.29%. So it's not always about identifying the ones with the larger column or the smaller column. No, we can actually identify that this one basically has the larger column. Yes, so we have to give the attention to this column here. But which age group in that column? So the age group to be given the attention in that column is basically this one here, which is actually that 5 to that 9. You also come to this point here, you address this age group of 30 to 34. You also come to the high income group, then you basically address this age group again of 15 to 19. So the same case to the education level, you can always break it down based on a different item, which can actually be the insurance type. So I can have the insurance type into the legend so that I can have it to be a stacked bar chart, just like that. We can also have a different item. Let's say, for example, we are breaking it down based on parity. We can just drag the parity into the legend, and this is it. So allow me to actually come up with some insights based on the parity. We can actually conclude that for the mothers whose educational level is actually high school, the inadequate prenatal care is actually the highest for those mothers who have a parity of 2, because the inadequate prenatal care is actually 47.22%. So we have to focus on this group when it comes to the mothers with education level of high school. So focus on those who have a parity of 2, because they are actually leading with a percentage of 47.22%. When it comes to the mothers whose educational level is actually college, we have to actually check on this one. This one is actually 42.22%, and this one is also 40.38%. So for the mothers whose educational level is actually college, the majority of the mothers receiving the inadequate prenatal care are actually the ones with a parity of 0. When it comes to the master's educational level, we can actually come up with an insight to that majority of the mothers receiving the inadequate prenatal care are the ones with a parity of 3. That is inadequate prenatal care of 45.10%. And finally, for the mothers with the bachelor's degree, majority of the mothers receiving the inadequate prenatal care are actually the ones with a parity of 3, because the inadequate prenatal care is actually that 5.42%. It's actually greater than this one here. This is that 2.08, but this is actually that 5.42%. So breaking it down like this will always help you when it comes to sensitization or having the outreach programs, because it will save you in terms of cost. So that's it. Now I would also want us to check on if low prenatal care is actually linked to high risk pregnancies. So to actually do that, we have to bring in something like a line chart like that, because we are trying to compare the two. So we'll be having the 2 lines, that is for the inadequate prenatal care in terms of percentage and the high risk in terms of percentage. Then we can actually have something like the age group. Then that's it. We'll actually check on the lines. So allow me to actually, I can just have it there. Then sorry, click on this like that. Then on this part too, I'll drag it like that. Then we have to get ourselves one of the items into the x-axis, which will actually be the age in terms of bins. Bins actually means from 15 to 20. This is the bin which you actually created, that is 15 to 20. Then it moves to 20 to 25. I can also do it again, there's no problem. So to actually create a bin, you just have to drag the age into the x-axis, click on this down arrow here, then hit on the new group. The age is actually bins, group type is actually bin type is actually size of bins, which is actually okay. The bin type is actually, the bin size is actually 5 like that. Then I just have to hit on okay in this part here, just hit on okay there. And basically you will also have that age bins, it's actually 4, because we had already created bin 1, bin 2, bin 3, and bin 4, which is They are all the same thing anyway. So I want us to drag the high risk in terms of percentage into the y-axis. So look for the high risk into the y-axis in terms of percentage into the y-axis like that. Then we also drag in the inadequate prenatal care in terms of percentage into the y-axis so that we can actually have the two lines. Wow. You can actually check that both of them are actually climbing up in this point. Then there's actually a drop there. Then in this point, there's actually a rise in both of them. Then in this case, there's actually a decline. So the only point where we have a difference is actually for the last age group, which is from that 5 onwards. But from 15 all the way to that 5, we can actually see that there's a very strong correlation between the inadequate prenatal care and the high-risk pregnancies. So we can actually conclude in this point that mothers with inadequate prenatal care from 15 years all the way to that 5 years are actually at a risk of high-risk pregnancy complications. And that's it. So this is basically the high risk percentage and the inadequate prenatal care percentage. And you can actually check that there is actually a correlation. This actually means that if we actually address the inadequate prenatal care, then we'll actually be reducing the high risk pregnancies. So that's all. Now I would actually want us to have some measures. So let's say, for example, we would want to obtain the average prenatal visits count. So what you are actually going to do in this point is to use the average function. Then we also go into obtaining the median prenatal visits count. So we'll actually be using the median function too. So all these are actually inside the pregnancies table because we are basically dealing with the prenatal visits count. So get yourself into the pregnancies table there, right click, then hit on new measure. So we'll actually say the average prenatal visits. So the AVG prenatal visits, visits, just like that, space equivalent sign as space. So in this point, we'll basically use the average function, then open, then we are dealing with the pregnancies table. So preg like that, then look for the prenatal visits count. You can actually check that it's actually here. So the table is actually the pregnancies table, and the column is basically the prenatal visits count column. Click on it once like that, close the average function, hit enter on the keyboard, and we'll have a new measure inserted there, which is actually the average of prenatal visits. We can also do the median of the prenatal visits. So what we'll actually do is to click on the table there. After clicking on the table, right click on it, then new measure, then it will be the median prenatal visits. So allow me to actually backspace and have median prenatal visits like that, space equivalent sign a space. Then we actually have to use the median function. So median, then you actually open break like that, so that you can actually have directly for the pregnancies table. So inside the pregnancies table, we are dealing with the prenatal visits count column. Click on it once, close the median function, hit enter on the keyboard. So we now have two measures, which is actually the average of the prenatal visits and also the median prenatal visits. So what you can actually do in this point, allow me to actually resize this. I'll actually click on this like that. So I'll have to resize this. So drag it down like that, so that I can have a space up there for the two cards. That's it. So in this point, we can just click on this card here, then resize it like that. Then after resizing it like that, click on the same card like that, Ctrl C to copy, then Ctrl V to paste. Then we just have to drag it to the right there. So we have two cards here. Click on the first card there, drag the average prenatal visits to the first card. On the second card, click on it again like that. Then you have to drag the median prenatal visits to the card. And that's all. So in this point, you can actually check that we have the average prenatal visits to be equivalent to 9.46. And we have the median prenatal visits to be equivalent to 9.00. Let's also check on the group of mothers who actually start their prenatal care in the last trimester. So I'll actually bring you to this table first. So inside the table view, we basically have what you call the prenatal visits count. And in this prenatal visits count, we actually have what you call the trimester first visit. So in pregnancies, we actually have 3 trimesters. The first one, which is actually the first 3 months, the second one, which is actually the second 3 months, and the last one, which is actually with the last 3 months. So 3 plus 3 plus 3 will actually get you an approximate of 9 months thereabout. Yes, it can be close to 9 months or just after 9 months there. So we have some of the mothers starting their prenatal visit or prenatal care in the last trimester. We have some actually starting in the first trimester, and we also have some starting in the second trimester. So I would actually want us to check on the mothers who are actually starting their prenatal care or prenatal visit in the last trimester. So to actually check on that first, it actually means that we have to count them. That is 1, 2, 3, 4, and so forth up to the last item. So what you are going to do in this point is to use the calculate function. That is, we are going to count the number of rows in this table here, where this column here is actually equivalent to that, just like that, and we'll actually obtain the count of the mothers who actually start their prenatal visits in the 3rd trimester. It's actually very simple to actually do that. So let's actually get back to the report view there. Allow me to actually remove this. So I would actually want us to obtain the count for the number of mothers who actually start their prenatal care or prenatal visit in the 3rd trimester. Very simple. So what you have to do, because you can actually check that the prenatal care is actually inside the pregnancies table. Yes, the prenatal visits count is actually inside the pregnancies table. So you can actually click on it like that, or just go into the 3 dots there. You click on the 3 dots, then you hit on the new measure. We can call this one the late first visit. Late first PC visit. That is the late first prenatal care visit. Don't let this actually confuse you. Late because that is actually the last one. So it's actually late, then first prenatal care visit. So we are basically checking on the mothers, that's the number of mothers who have actually started their prenatal care in the last trimester. So the last trimester for them is actually the first prenatal care. So late first prenatal care visit. So the number of mothers who have actually attended their prenatal care in the 3rd trimester. So space equivalent sign a space. So we'll basically use the calculate. So we calculate, then we introduce the count rows. So we are counting the number of rows basically inside the pregnancies table. So pregnancies table like that. Then you actually click on it once. Then you actually close the count rows function there. We are basically obtaining the number of rows in the pregnancies table. Where? So the aspect of where is actually being brought in by the use of the calculate function, where the column is basically equivalent to that. So you have to type preg like that. So pregnancies table, we have the trimester first visit. Click on it like that. So where the trimester first visit, which is basically inside the pregnancies table, is equivalent to that, just like that. Then close the quotation. Remember, we are having this that inside the quotations because it's a text. If it was 3, then we couldn't have had the quotations inside it because it's basically a value. But because it's a text, we have to get ourselves the quotations there. So that like that, then you close the quotation, then you have to close the calculate function. The moment I hit enter on the keyboard, check will actually be having a measure there. It must be inside the quotation, and do not actually forget the equal sign there. So trimester first visit should be equivalent to that. Then you have to close the calculate function, then hit enter on the keyboard, and that's it. Now you can actually check that we have late first prenatal care visit. Hit on a card, then after hitting on a card like that, we can just drag the late first prenatal care visit into the card. Just like that. And now we can actually check that the total number of mothers who actually visited the health facility for the first prenatal care is actually equivalent to 376. We can as well obtain the percentage for this. It's actually very simple. So to obtain the percentage for this, what we have to do is to come to this point again, that is inside the pregnancies table. Then we have to right click. After right clicking, we have to get ourselves into the new measure there. Then inside the new measure, we'll actually say the late first PC visit percentage. Yes, that's it. Then space, equivalent sign, a space. So in this point, we'll basically be doing the division. So divide, then open, then a square bracket so that you can actually pick the late first PC visit. So late, it's actually here. Click on it once like that. Then we are dividing that by the total number of rows inside the pregnancies table. So in this point here, we have to say count rows like that. Then I actually open, then break. So I'll hit on the pregnancies there. Then I close the count rows function. Then a comma. Then the alternate result will actually be a 0. That is, in case of an error, then just have a 0 there. Then we actually close the divide function. Then hit enter on the keyboard. Then we'll basically have that measure here. Late first PC visit in terms of percentage. So I'll actually click on another card so that we can actually see what that 376 actually represent in terms of percentage. So drag the late first PC visit in terms of percentage into the card. We can actually check that it's 0.34. We can click on the measure there, measure tools tab. Then in this point here, we have what you call formatting. Then click on general there, hit on percentage. So in terms of percentage, it's basically equivalent to that 4.18%. I want us to check on the distribution in terms of age. So what we'll actually do in this point, we can use a line chart. That's actually fair enough. So I drag it down there. Then I also drag it to the right. Then I drag it up there. Allow me to also drag it up there like that. And it's actually done. Now in this point, we will have to drag the age into the x-axis. That is the age in terms of bins into the x-axis. So drag one of them into the x-axis. So remember, this age bins 4 is equivalent to bins 3 is equivalent to bins 2 is equivalent to bins 1. So we actually repeated because I wanted you to actually master that. So for the x-axis, we'll actually be having the late first PC visit. So drag it down there. Then on this part here, we have the percentage. So we can just take the percentage into the y-axis, just like that. You can actually check that the number of mothers who actually go to the health facility for the first prenatal visit actually increases. The number actually increases from the age of 15 all the way. The number increases all the way up to age 30. Then it actually declines all the way to age 35. Then it also increases all the way to age 40 there. So we can actually say that there's a rapid increase. Yes, there's a rapid increase from age 15 to age 30. That's a rapid increase of mothers attending the health facility for the first prenatal care in their third trimester. So we can basically say that from the age of 15 years to 30 years, the number of mothers attending the health facility for the first prenatal care in the third trimester is rapidly increasing. You can check from this part here, it increases. That's from 28.57. It increases to this point, 30.99. It increases again to that 5.76. It also increases to that 6.98. So from the age of 15 to 30, yes, the number of mothers attending the health facility for the first prenatal care visit is actually rapidly increasing. That's what you can actually conclude in this point here. So if we would actually want to have a change, let's say, for example, we would want to sensitize the mothers on attending the prenatal care visit in the first trimester or in the second trimester, then the age bracket to actually focus on is actually this one here, from 15 all the way to 30, because that's where we actually do have a rapid increase. So if we actually focus on this age group here from 15 to 30, then we can actually increase the number of mothers attending the first prenatal care visit in the first trimester and in the second trimester, hence reducing the number of mothers attending the health facility for the first prenatal care visit in the third or in the late trimester. So that's how you can actually break down this in terms of age group. I would also want us to check if we can break it down in terms of income. So I'll actually remove it. Then we have the line chart still. So I'll bring in the line chart. So we have to drag in the income group. So bring in the income group into the x-axis like that. Then we have to drag in the late PC visit in terms of percentage, that is into the y-axis. So drag it into the y-axis like that. We can actually conclude that mothers who are actually earning low income, or mothers in the low income group, have the highest late first prenatal care visit of that 6.10%, followed by mothers in the high income group who actually have the percentage of that 4.07%, and the mothers in the medium income group are actually the ones having the late first PC of that 2.19%. I would also want to see if there's a relationship between the late first PC visit and the high risk pregnancies. So what you are going to do in this point is to remove the late first PC from the y-axis there. Then we just have to use the age group. So you drag the age group into the x-axis like that. Then into the y-axis, we have to drag the high risk percentage. Then we also drag the one for the late first PC visit. So high risk percentage into the x-axis like that, into the y-axis like that. Then on this point again, late first PC visit in terms of percentage, drag it into the y-axis again. In this point, we can actually say that there's a correlation, because the only point where the correlation doesn't actually exist is this point here for the age group of 20 to 25. Because in this part here for 15 to 20, you can actually check that late first prenatal care visit actually means high risk. In this point again, from 25 to 30, you can actually check that as that one increases, this one also increases. As this one decreases, this one also decreases. As this one increases, this one also increases. So basically, we can actually say that having a first prenatal care visit in the third trimester actually poses a higher risk. So in this point, I want us to actually check on the dashboard. So when it comes to the dashboard, I would actually advise you to check on the dashboard first until you actually check on the 10 analytics that you actually made. Remember, we actually so the 10 analytics and the links are actually down below inside the description. See how we actually obtain this count. See actually how we obtain this C-section rate, how we obtain this C-section rate for City Medical Center Hospital, how we obtained all this, that's the low risk C-section count, how we obtained all these measures, and how we actually analyzed that data, because it's actually very important. So it's very important for you to actually understand how those measures were actually obtained, and also very important for you to actually understand how that measure created was used to analyze the data. So that in this point here, when I will be creating the dashboard, you will be understanding what every measure actually represents. So in this point here, we actually had the average maternal age. We also obtained the readmission rate. We also saw the low birth weight rate. We also saw the NICU admission rate. We also saw the preterm birth rate. And we also saw the median gestational age. So I want those ones to be inside the card. So I'll actually click on a card like that. Then I can resize it. So the items that I actually mentioned are 6. So this one, I'll click on it like that. Then drag it like that. Yeah, something like that. Then also reduce the size here. And so that you can have something close to that. So hit Ctrl C, Ctrl V, Ctrl V again, Ctrl V again, Ctrl V again, Ctrl V again. I think they are now 6. So have this one to the right there. Drag this one again next to that. This one again in line with that. This one again to this point. And finally, we'll be having one with a very small space there. But I'll actually try to squeeze this. So just like that, so that we can see if this can fit there. So we have about 6 items. That is the average maternal age in terms of the mother's age, the readmission rate. So for the average maternal age, I'll actually show you, it's basically here. So down here, we'll actually check on the average maternal age, which is actually here. So this is basically the average age of the mothers. So how we actually obtain that measure, it's actually here. The average maternal age is actually equivalent to the average age of the mothers, and the age is actually inside the mothers table, just like that. The second one is actually the readmission rate. So the readmission rate is basically up there. So scroll up there, you can actually check that we have the readmission rate inside the deliveries table. So scroll up there, you can actually check that the table is actually the deliveries table, and it's actually the readmission rate. That's actually the measure which we actually created. And how did we actually obtain this measure? We actually obtained that measure by using the divide function. So divide the readmission count by the total number of rows inside the deliveries table. Then we actually obtained the readmission rate. We also checked on the low birth weight rate. So on the low birth weight rate, we can also drag down here, and you can actually check that we add it here. Click on it so that you can see how we obtain that measure. It's actually here. So the low birth weight rate is actually equivalent to, we actually used the divide because we add the count for the low birth weight rate divided by the total number of infants. So the total number of infants, we actually add the low weight divided by the total number of infants, and it will actually get you the low birth weight rate. And we also checked on the NICU admission rate. So the NICU admission rate is basically here. If I click on it, you'll actually see how we obtain that measure. It's actually divide the NICU admission count divided by the total number of infants. So NICU admission count, the total number of infants who are actually taken to the NICU, then divided by the total number of infants who are actually delivered in that hospital. Then we also checked on the preterm birth rate. So I think that's actually the last one here. The preterm birth rate. Preterm birth rate is actually here. So click on it so that you can check how we actually obtain that measure. So preterm count divided by the total number of rows inside the infant's table. Then finally, we check on the median gestational age. So for the median gestational age, you'll actually check that down here, we have the gestational count. That's the gestational age in weeks. And you'll actually check that the age is actually in weeks, not in terms of years. It's actually in weeks. So obtaining the median gestational age, we'll actually scroll up there, and you'll actually check that you have the median gestational age. I'll actually click on it, and this is basically how we obtain the median gestational age. We just use the median function the same way we actually use the median function also in Excel. So the median function, gestational age in weeks, is actually inside the pregnancies table. So pregnancies table, and in that table we have the gestational age in weeks. That's the column. So I want us to have all that data inside these cards here. So first of all, we can just drag the median gestational age to the first one there. So first of all, we just have to click on the first one there. Then we just come to this point and click on median gestational age. And the median gestational age is basically equivalent to 32 weeks. So what I actually do is to squeeze this like that so that you can have kind of a space there. Then click on the second one. For the second one, I want us to have the average maternal age. So scroll up there so that we can obtain the average maternal age. And the average maternal age is actually inside the mother's table. It's actually here, the average maternal age. So because it's actually selected there, I'll just come to this point here and click on it. And I have that 1.33. But remember, in data analytics, we always prefer to use the median than the average, because the median will actually be more effective than the average. Now in this point, I want us to also check on the readmission rate. So the readmission rate is actually inside the deliveries table. So we have inside the deliveries table, we have the readmission rate. Remember, the card is actually selected. So in this point, you just have to check on it like that. And it's actually 8.73%. In this case here, we also have to check on the low birth weight rate. So scroll down there, and you will actually check that we have the low birth weight rate here. And because the card is actually selected, I'll also click on that point here, and you'll actually see 20.18%. The next one is the preterm birth rate. So I'll click on the next card. So the preterm birth rate is actually here. So I'll actually select on it like that, and that's actually done. That's 63.82%. And on this part here, we will have the NICU admission rate. So for the NICU admission rate, it's actually still inside, this is basically the infant's table. So click on that card there. NICU admission rate, select it like that, and it's actually done. So we have some of the key indicators or the key metrics when it comes to this health analytics, because we already have the median gestational age for the mothers, the average maternal age, again, this is basically for the mothers. We have the readmission rate, we have the low birth weight rate, we have the preterm birth rate, and we also have the NICU admission rate. So those are some of the most important metrics that you must have when it comes to this analysis here. So the other item which you are going to start with in this point is the C-section rate by hospital. So for the C-section rate by hospital, what I would actually want us to have is to click on a column chart there. After clicking on a column chart, allow me to actually drag it like that. We can have something like that. Then you also drag it to the right, C-section rate by the hospital. So what you'll actually do in this point is to click inside that visual there, which is actually the column. Then come to this point here, select the hospital name. So where do we actually have the hospital names? We have the hospital names there, and you can actually check that we'll be having the hospital names on the x-axis. Then on the y-axis, we'll basically be having the C-section rate. So the C-section rate on the y-axis, just like that, and it's actually done. So if I hit on the focus mode there, you'll actually check that the hospital with the highest C-section rate is basically the university hospital, because the C-section rate is actually 69.69%, followed by the Metro Health Hospital, which has the C-section rate to be 55.26%. And the hospital with the lowest C-section rate is actually City Medical Center, which has the C-section rate to be 42.93%. So the highest one is actually the University Hospital, 61.69%. The lowest one is actually City Medical Center, 42.93%. So basically that's how you can actually deal or analyze the C-section rates by the hospital. I want us to check on the next item too, which is the average length of stay by hospital. You'll actually realize that for the length of stay days, we have not actually obtained the measure for the average length of stay. I don't know if we had actually obtained, let's scroll down there so that you can check if we also have another length of stay. So basically you can check that we do not have another length of stay. We only have the length of NICU stay days, but we were not actually focusing on that. We were actually on the length of stay days. So what you have to do is to actually create a measure. So get into the deliveries table there, right click, then hit on a new measure, and you'll actually say the average length of stay. So backspace the measure and the equal sign so that we can actually write the average length of stay. So backspace there and average length of stay, then space equivalent sign a space. So we'll basically say the average length of stay, we have to use the average function. So I'll click on the average function there, then it will actually open. So what are you obtaining the average for? I'm obtaining the average for the length of stay days, and that length of stay days is basically inside the deliveries table. So deliveries table there, then select length of stay days. So just like that. So length of stay days. So the average of length of stay days, and this length of stay days is actually a column inside the deliveries table. Close the average function like that, hit enter on the keyboard, and basically we'll obtain the average length of stay days. So average LOS, average length of stay days. Now, what you actually do in that case is to use, allow me to actually use a bar chart. I'll click on a bar chart there. Then it's actually down here, which is actually okay. I won't actually resize that because you can actually check that the size is almost the same as what you had there. So I'll click on that bar chart there. Then I come to this point here. Then it's actually the average length of stay by hospital. So I'll click on the hospital name. Then I also go to this point here and tick on the average length of stay. So remember, you can always drag and drop. So for the y-axis, I have the hospital names, and for the x-axis, I have the average length of stay. So it's actually here. So I can actually hit on the focus mode so that you can check on that. So hitting on the focus mode, you can check that for the average length of stay, we have the City Medical Center having the highest average length of stay to be at 4.19 days, and the lowest average length of stay is basically for the University Hospital. The average length of stay is basically 4.02 days. They are actually very close together. The lowest is actually 4.02 days and the highest is actually 4.19 days. So that's why you are actually seeing that the bars are almost of the same size. So this one is actually 4.19 days, then 4.12 days, then 4.05 days, 4.03 days, 4.02 days. So the bars are almost of the same size because the average length of stay is almost the same for all the hospitals. So we have the C-section rate by the hospital name and the average length of stay by the hospital name too. Now, I would also want us to check on the inadequate prenatal care rate by insurance type. So in that point, we can actually use a line chart, and then I'll actually try to expand this like that. So it's basically the inadequate prenatal care rate by insurance type. I'll come to this point here. That's for the mother's table. Then I'll actually select the insurance type there. Then I'll also go down there so that I can select the inadequate prenatal care in terms of percentage. So it will be the rate. Select it like that. So in this point here, you can actually check that for the Medicaid insurance, the inadequate prenatal care rate is actually equivalent to that 5.60. It's actually that 5.60%. This one here, which is basically for the unknown, these ones are actually the mothers whose insurance were actually unknown. So they actually had the insurance, but it was unknown. So their rate is actually that 3.52%. For the private insured mothers, their inadequate prenatal care percentage was actually that 2.89. For the uninsured mothers, their inadequate prenatal care is actually that 1.01%. And finally, for the Medicare insured mothers, you can check that their inadequate prenatal care is 28.80%. So basically, that's how you can analyze the inadequate prenatal care by insurance type. I would also want us to check the next one to be the high risk rate by education level. So the high risk rate by education level. So we actually had the education levels. I can actually show you for the education level. So for the education level, it's basically inside the mother's table. This is where we basically have the education level. So I can get into the table view there, click on the mother's table there. Then you'll actually check that we have the education level here. Click on the down arrow and you'll actually identify that they are 4. Bachelors, that's the mothers with their bachelor's degree, mothers with college education level, mothers with high school education level, mothers with master's education level. So basically they are 4. Bachelor's, college, high school, master's. So because they are basically 4, we'll actually use a pie chart. Remember, a pie chart is actually so good when the items are not actually more than 4. So if it actually goes too high, then it could be 5, but not an item that is actually containing 10. It will actually make the data to be dirty. So in this point, I'll click on a pie chart. And when you are actually clicking on a pie chart, remember to actually make sure that none of the visual has actually been selected. Yes, because if this visual is actually selected, then you come to this point and hit on a pie chart, then you'll actually see that it will change. But that's not actually what I wanted. So this one was actually a line chart. So click outside any visual. So click outside all the visuals like that. Then you can now go and pick on a pie chart. Then after picking on a pie chart, you can actually check that this size here is the same size for the above visual. So I won't actually change anything. So in this point, we are going to do the high risk rate by education level. So scroll down there to where we basically have the high risk rate. And this is it. So the high risk rate by education level. So scroll up there into the mother's table where we basically have the education level and select it like that. And that's it. So basically we have the high risk rate by education level. And you can actually check that mothers with this one is basically the bachelor's education level. So mothers with bachelor's education level are the ones having the high risk rate because they are actually leading with 28.1%, followed by mothers with this one. You can actually see that it's being activated there, followed by mothers with master's education level because they are the second with 25.04%. So that's it. Now in this point, I would also want us to check on that item, which is basically the smoking rate by age group. So for the smoking rate by age group, allow me to actually click outside. I would actually want us to use a table. So I'll click on a table there. Then that's it. Then bring it to this point here. I think, yeah, that point there. Then drag it to the right. So in this part, make sure it's actually selected. So we'll actually be using the age bins. So I already showed you how to create these age bins. So make sure you actually go through the 10 analyses below inside the description so that you can actually understand everything about this data set before you actually come to the dashboard. So I already told you how we can create this. So I'll just select on the age, which is actually in bins. But if you would actually want me to actually show you again, then you can just click on it like that. But if you would actually want me to actually show you how that can be obtained, like if I click on the age bins there, you can actually check that it's 15 to 19, 20 to 24, 25 to 29, 30 to 34, 35 to 39, 40 to 44. That's what these bins actually mean. So you have not actually been told that it's 15 to 19. You'll actually be told that the next one is 20. So you have to actually use your mind that this is 15 to 19. In this point here for 20, the next one is actually 25. So you have to use your mind that this is basically 20 to 24, just like that. So allow me to actually show you that again, how we can actually create the bins. So you select on the age like that, then come to this down arrow, click on it there, then hit on new group. Then inside the new group, do not actually change anything. So age is actually in terms of bins like that. Then group type is actually bin. Bin type is actually the size of bins, and the bin size is basically 5. That is 15. The next one is 20. The next one is 25. The next one is 30, 35, 40, just like that. So what I have to do is to hit on OK here, and that's all. So the moment I actually allow that, it will actually load, and you'll actually check that we have 15 to 20, 25, 30, 35, 40. So this is a bin size of 5. And you can actually check that the last one was actually age bins 4, and we have already created age bins 5. So it's actually selected. Now in this point, we are dragging the smoking rate again. So for the smoking rate, we'll actually select. So scroll down there to where we have the smoking rate. Then you just have to select it like that. That's all. So if I hit on the focus mode there, you'll actually check that the smoking rate is actually too high for the mothers whose age is between 40 to 44 because they have 13.04%. That's it. Now, finally, I would also want us to see the late first prenatal care visit by income group. The late first prenatal care visit by income group. So what we actually mean by the late first prenatal care visit is that we are actually trying to see the number of mothers who actually attended their first prenatal care in the 3rd trimester. That's why we are actually calling it late. So it's the late first prenatal care visit by income group. So what you can actually use in this point, allow me to actually bring this down here so that we can actually use the space up here for a donut chart. So I'll actually click on a donut chart like that, then drag it to the right. So in this case, it will be the late first prenatal care visit by income group. So I have to select the income group, which is actually here, and the late first prenatal care visit. So scroll down there to where we basically have the late first prenatal care visit. It's actually here. Yes, the late first prenatal care visit, which is actually in terms of percentage, into this donut chart. And basically, you can check that this one is the highest. This one is actually taking 35.27%. The majority of the mothers who actually attend their first prenatal care visit in the 3rd trimester are the ones with the low income group, followed by the ones in the high income group because they are actually 33.28%, and finally followed by the mothers in the medium income group because they have that 1.45%. So this is it. Now allow me to actually come up with some insights. So for the insights, allow me to reduce this like that. Then I can actually have a text box. So insert in this point, I actually say a text box. Then yeah, this space, it has actually fitted there. So that's it. And now let's come up with the insights. So in this point, we can actually say, we can call this one quick insights like that. Then, so for the first one, just have to click outside. So you can check that the C-section rate is actually highest when it comes to the university hospital. So we can actually say university hospital has the highest C-section rate at 61.69%. So come to this point, university hospital as the highest the highest C-section rate at 61.69%, just like that. The second one, so click outside there so that you can actually come to this point here. You can check that the inadequate prenatal care is actually highest when it comes to those mothers who are actually using the Medicaid insurance cover. So for the Medicaid insurance cover, the mothers are actually accounting to that 5.60% of the total. So that 5.60% of the total, you can say the mothers using Medicaid, I can have capital M, Medicaid insurance covers account for the largest percentage, account for the largest rate in inadequate prenatal care, standing at that 5.60%. Yes. Number 3. So for number 3, we can actually use this one here. When it comes to the mothers making the prenatal care visit for the very first time, majority of the mothers visiting for prenatal care in that trimester, yes, are from the low income group. So just like that. Let's actually go to number 4. So click outside like that. In number 4, you can clearly check that the average length of stay in the hospitals. So you can actually say that for the average length of stay in the hospitals, in this one, it won't actually be a very big difference because all of them are basically 4 anyway. So this one is basically 4.19 days, yes, which is actually of no big difference with 4.02 days. So let's also come to this point here and check on the high risk by education level. So the high risk rate is actually high for the mothers whose education level is basically bachelor's. You can check that it's 28.1%. So the high risk rate is higher, is the highest for the mothers whose education level is bachelor's degree, just like that. So whose education level is bachelor's, just like that. And for the smoking rate, you can actually conclude that majority of the mothers who smoke are aged 40 to 44. So finally, majority of smoking mothers are aged 40 to 44. So just like that, and I think everything is now done. So allow me to actually minimize this because we are not interested with the visualization again. Minimize that again. So we have this kind of a thing here. So in this case, allow me to drag this a bit like that. In this point 2, I can just drag this up like that. We can basically give this one a bold formatting. So select like that, then hit on bold there. So that's it. So you can actually check that everything is okay here, but I would actually want us to reduce this card from the top so that we can have the name, the title up there. So reduce the card from the top again, this part from the top like that. This one again from the top. This one again from the top. This one again like that. And finally this one, reduce it from the top, just like that. So in this point, I want us to insert a text box just above those cards so that it will be containing the title for the dashboard. So just like that, and we can drag it up there. So just have it somewhere at the top like that, and this one again, yeah. And in this case, you can just drag it a bit like that. It's done. For this point, you can just drag it like that again. We can have the title to be maternity and child health analysis in the United States, that is in the USA, just like that. And it's done. So select bold, then centered, then now you can increase the font size. So for 11, we can just hit 14 and check. 14 ain't that bad. We can go to 20. 20 is too big here. You can stick with 14. So 14 is not that bad actually. So this is basically what we have. We can basically change the design here. That is the theme. So come to this point here for the themes. Then you hit on the down arrow there. Then you can click on this one here. That is inside the Power BI group. You can click on the first one there, and that will be the output. So again, what you'll actually do in this point, allow me to actually adjust there. So drag this to the right like that, and on this case, I'll drag this to the end there, and this part too. So we have the quick insights there. We have the smoking rate here, the late first prenatal care visit, the high risk by education level, the inadequate prenatal care by insurance type, the C-section rate by the hospital name, the average length of stay by the hospital name. At this point, allow me to actually squeeze them a bit so that we can have something almost like a line. So just like that, and we'll get something like that. Yes, that's what I actually wanted. So in this point again, make sure there's actually something like, yeah. So just something small like that. Yes. On this part again, make sure there's something small like that. A dash, that's okay. On this case too, just a dash like that. That's actually okay. On this part too, to the left a bit. That's cool. So in this case, yeah. Finally, what you can actually do is to drag this. So allow me to have this, reduce it like that. Then I'll actually drag it like that. Then I also click on this point so that I can drag it a bit down there. And that's all. So I can now expand, and you can basically see that it's now perfect. So this is now a very good dashboard. That's the maternity and child health analysis in the USA. So we have the median gestational age, the average maternal age, readmission rate, low birth weight rate, preterm birth rate, NICU admission rate, and everything else is actually good. We have other 6 visuals here. This is a column chart, a bar chart, a pie chart, a line chart. This is a table, and this is a donut chart. In this point here, we have the quick insights, and up there we have our 6 cards. So that's all about this project, and thanks for staying tuned.